Good morning. Good morning, everybody. I'm Miss Sullivan. I'll be teaching your review course today. Can everyone hear me? Can anyone hear me?
Good morning. I can hear you.
Ah, excellent. Good morning. Sorry, my microphones were
No.
acting up. So I know it says my name is Lois Hammer. I'm actually Nicole Sullivan, and I will be teaching your review class today. So I'm checking to see who's here. We have Sydney, Christina, Francis, doesn't look like they're here yet. Zachary, you're here. Oh, I can't hear anything. All right. Everyone else can hear me, right?
Yeah, I can hear you.
Yes.
Okay, so.
Yeah, I can hear you.
Okay, but it looks like Sydney and Zoozle can't. So let's figure out those two. So it has something to do, they're not muted. Oh, they're muted. I swear it takes more time to get, oh. I can hear now. You have to connect to audio and mute yourself. Me?
No, I think she's saying that's everybody
Oh, I'm like, that won't go over well.
else.
No, you just have to connect to the audio and then you can mute yourself after that.
Okay, fine. I'm sorry.
you.
I just noticed all of a sudden. And Zuzel, can you hear now or no? No, still no. I don't know what that was, but is that a yes? Oh, you can hear me. Zuzel, can you hear me? Okay. Well, if you can hear me, that's fine. I can't hear you. So if you have something to say or ask, I guess just type it because I don't know. I'm not at your house, so I can't help you fix your computer. But sometimes it's you know, hard to get through here. So I'm Miss Sullivan, Nicole Sullivan. I'm going to be teaching your review course today. I know it says Lois Hammer. That's not really my name. That's just the person that runs the course. So Jacqueline,
I think Suzel sent a message in the chat.
She did. I see it.
Oh, okay. Sorry.
But it's saying, can you hear me? And I'm saying, I still can't hear him.
Oh,
Can
yeah.
you guys hear him?
I think their audio isn't on.
Okay.
Can you hear me now?
Who is that?
Suzelle.
Yes. Oh, I'm pronouncing your name wrong. Yes, I can hear you now.
Great, thank you.
Okay, so it looks like everybody's here. So I don't think I know any of you guys. I do teach a lot of these review courses. I like to maybe do them a little differently than other people. I like to do PowerPoints. At the end of this class, what I'll do is I will make a Google Classroom for you. And I'll invite all of you. I have all your email addresses here. So log on to the Google Classroom. What I'll do is I'll post our Zoom meeting from today in case you want to go back and like kind of check anything. I'll also open up tests to take for infection control that you can take and then download the results to study from. I like to do a lot of interactive quizzes with you guys to make sure that you understand what we're doing. Hopefully that works for you. That's how I learn best. So I don't know, it seems to work for the other people that I taught. So let's try it and see how you guys do. Okay. So we have 2 Sundays together, this Sunday and next Sunday. And then again, you guys will be able to go back. I'll leave that Google Classroom open. I'll post all the PowerPoints in there. I know a couple of you don't have your books yet. But that's the PowerPoints will be posted there. So even if you don't have your books, you can still go back there and look through the PowerPoints, which are basically the most important part of your books anyway. And then, like I said, I'll open up tests that you'll be able to go on and take and able to ask questions on Google even after our review is over. Okay. So I'm going to get started. I feel like one person just 1, 2, 3, 4, 5, 6. One person left, but they were here. So I'm not sure why I have to take attendance, but all right. I don't know. We'll figure that out along the way. I guess she'll zoom back in when she gets her stuff together. So, okay, just give me a second. I'm going to get my PowerPoints together for you. So, while I'm doing this, I'll just give you a little information about myself. I actually teach a dental assisting class down here. I'm in South Jersey, down here in South Jersey, and I teach dental radiology. So I've been doing it for 3 years and I love it. I have a lot of information. I've been dental assisting for 20 years, which I also still do. So if you have any questions or don't understand something, please don't hesitate to ask. You guys have your MDA book, Modern Dental Assisting? Does
I
everyone have
haven't
that?
gotten my yet.
Yes.
But so
Yeah.
what did you get, the 12th or 13th edition?
The 12th.
Then let me use that to do the PowerPoints. That way you can read along if you have to. All right. Of course. Because this is the new one anyway. So I'll go on to the 12th edition. And that way, things haven't changed that much in the 13th anyway. But that way you guys will be able to follow along in your books. Because I have both, so it doesn't really matter to me. Another book I like to use a little bit is this green book. I realize you guys don't have it, but anything I use from there, I will post the chapters again on our Google Classroom. So don't worry about it if you don't have that book. It is one of the recommended books for the infection control tests. So that's why it goes into a little bit more detail than this. So I do use it sometimes. So don't stress out. I know you don't have that green book, but anything that I talk about, I'll post. So you'll be able to get to it, okay? Let's see. Usually start with chapter 18. Okay. This is usually the hardest for everybody to grasp. So if you have any questions, pretty please stop me. All right. A big part of infection control is understanding microbiology. It's not easy. It's very scientific. If I have like easy ways to teach you anything, I will. Microbiology, a lot of it is just memorization. I kind of can't help you with that, but if I know any like shortcuts on how to remember it, I'll definitely say. All right, so microbiology is the study of microorganisms. So a lot of times what I like to do, I was an English major in school, so I like to pick words apart. And a lot of times if you stop, even if you don't recognize a word and you can pick the pieces of the word apart, it's going to help you to or it's going to help you to decipher the meaning of the word. Okay, so microbiology, micro means what? Literally. Anyone? What does micro mean?
Small.
Small, okay? And then biology is living organisms. So microbiology, study of living organisms, all right? Dental assistant needs a foundation of microbiology to understand the nature of pathogens and how to prevent the transmission of disease in the dental office. Everybody here works in a dental office. That is a plus for you guys and also a big minus for some of you, because a lot of times what goes on in the dental offices is not necessarily the correct way to do things. I know I worked in a dental office for sorry, I keep moving you around, for 20 years. So I know that things that go on in the dental office aren't 100% always as they should be. So if you see something here that you're not doing in your dental office, ask. if I'm teaching it, this is how it's supposed to be done. Once you guys get out in your offices, honestly, I don't care what you do, but in order to pass this board, you need to know the right way. Okay. So just bear with me. I know some things are going to be different, and it's only because people get lax as they, as they're working. So the two major oral diseases are bacterial infections. We have dental caries, which is another way of saying cavities, right? And then periodontitis. So in microbiology, we have some important names, and I know some of these names will definitely be on your test. So if I know one that's definitely on there, I will throw it in. But Aristotle should sound familiar to most of you. He was around in the early BC's 300s. He believed that life arose from muck, decaying food, warm rain, or dirty shirts. Okay. He was kind of the start of everything microbiology. Antony von Leeuwenhoek was around in the 1600s. He used a primitive microscope to observe stagnant water, hay infusions, and scrapings from the teeth. Okay, what he found with this microscope was that there's little organisms living in all of these things, both stagnant water, scrapings from teeth. John Tyndall was around in the early 1800s. He discovered that some form of bacteria existed in two forms, heat stable and heat sensitive. We'll get more in depth with that. And Joseph Lister was the first to recognize the role of airborne microorganisms in post-surgical infection. Okay. Robert Koch, he is also very important. He developed a two-part dish for growing bacteria. Does anyone know what the name of that dish is? So think back to biology in high school. You used a dish to put some stuff on. Do you remember what it was called? It begins with a P.
Petri dish.
Yeah, okay. And so here we have Julius Petri, which is next. Petri plates, dishes used to isolate bacterial colonies, were named after him. Okay. So we have Julius Petri and Robert Koch kind of working together during the same time frame. Robert Koch is developing a two-part dish for growing bacteria. Julius Petri developed the Petri dish, which we still use today. Louis Pasteur should sound awfully familiar to you. His last name should remind you of the word pasteurization. What do we pasteurize to this day?
Milk.
Milk, okay. Father of microbiology, developed the process of pasteurization and discovered the first vaccine for rabies, okay? Louis Pasteur is pretty huge, so it's a good name to remember. This is a Petri plate, okay? It should look kind of familiar. The bottom of the Petri plate has something called agar in it. That should sound maybe familiar, maybe not. It's something that some old school offices still use to take impressions. Agar, but anyway, it's a good bottom to grow bacteria on. It's a good surface. So, and you can separate them, into different colonies. And so you see that, when they swiped here, we have, I don't know, we'll learn about this, but it looks like a round bacteria. See that little round bacteria? And that's called the coccus or cocci bacteria, the round one. And we'll learn about that in a minute. So Koch, we just talked about him, right? Robert Koch, he was the one that developed the two-part dish. He has something known as Koch's postulates, all right? So sort of a list of things that are always the same when he takes when he puts his organisms into his dish. So first thing, the microbial agent must be found in every case of the disease in order for it to be called a bacteria, okay? The number two thing, the microorganism must be isolated and grown in pure culture. If it's not, if it gets contaminated, it's not a pure culture, okay? So it's not going to tell you anything about it. The microorganism must cause the same disease when inoculated into a susceptible animal, all right? And then the same microbial agent must be recovered from the inoculated animal. This sounds confusing. This picture will clear it up. So fluid is removed from the medulla of a rabid dog. It's mixed with saline, injected into rabbits. Okay, the virus migrates to the spinal cord and the brain of the rabbits. The spinal cord from the last rabbit is removed, dried into a powder, mixed with liquid to be injected into humans and dogs to prevent rabies. Okay, so think of the flu shot, which we still obviously use today. What exactly is the flu shot? What are we doing when we give ourselves a flu shot? Does anyone know? If not, that's okay, because I know. So when we give ourselves a flu shot, we're actually giving ourselves a live flu culture. Okay. So we take a flu shot, and then what happens, that's why some people actually get symptoms of the flu. When they get the flu shot, you're giving yourself a live culture. And what happens is your body takes that and produces antibodies to fight that off next time. So now they've been exposed, now your body's been exposed to it, and your body is able to fight off that disease should it come again. All right. Another thing that, sorry for the men in the group, but nursing. Okay. If you have children and you nursed your child, you can pass your own antibodies on to your children so that they won't catch certain diseases. For example, when my son was a baby, everyone in my house had the flu, and I nursed him through it, which sucked, but I did it. And then he never got the flu because he had my antibodies. All right, so I gave him the live culture, right, through my nursing, and he got the antibodies and then didn't get the flu. All right, so think of it like that. This is just a picture of Louis Pasteur. All right, so we have some major groups of microorganisms, and we'll go over each in detail. Okay, we have bacteria, we have rickettsiae, algae. Some of these should look familiar to you. Protozoa, fungi, prions, and viruses. And these are the major groups of microorganisms. All right. Bacteria is our first group of microorganisms. It's a large group of one-celled microorganisms that vary in shape, size, and arrangement. Pathogenic bacteria usually grows best at 98.6 degrees in a moist, I hate that word, dark environment. What looks familiar about 98.6 degrees? Does that temperature look familiar? What is that the temperature of? Does anyone know? If you take your temperature, what is your temperature supposed to be? I'll give you a hint. It's 98.6 degrees. All right. So 98.6 degrees is our body temperature. That's our average body temperature. Okay. So when we say bacteria grows best at 98.6 degrees in a moist, dark environment, what is one of the things we're talking about? It very much pertains to dentistry. I know it's early, guys. How about the mouth? Okay. All right. So pathogenic bacteria grows best there. Skin, respiratory tract, gastrointestinal tract are inhabited by a great variety of harmless bacteria called normal flora. Okay. You always have normal flora or bacteria in you. It's not, even if you cleanse yourself, you're still going to have regular bacteria. Not all bacteria is bad. Okay. This normal flora is harmless bacteria. Okay. And it lives in your skin and your respiratory tract and your gastrointestinal tract. All right. It's harmless. Infection occurs when bacteria occurring naturally in one part of the body invade another part of the body and become harmful. Okay. So I started to talk about this earlier. There are 3 shapes of bacteria. We have spherical or round. Okay, that's the coccus or cocci bacteria. It reproduces by dividing in 2. It forms chains as they divide that are called streptococci. Does that, any part of that look familiar to you? That word?
Strep throat.
Yes. Okay. It literally causes strep throat. So if you were to take that word apart, it would be the round spherical shaped bacteria that causes strep throat. Okay. Cocci that form irregular groups or clusters are called staphylococci. Why does that word look familiar? What do you suppose that causes?
Staph infection.
Correct. Staph infection. Okay. So again, even if you've never seen these words before, sometimes you can kind of take them apart. So now you know this N word, COCCI. So you know that means spherical shaped bacteria. Okay. And then, you know, the front of the word you can kind of decipher if you've seen it before. The second kind of bacteria is rod shaped or bacillus, plural bacilli. And finally, we have spiral shaped bacillus, also called spirillum or spirilla. This is what they look like. Okay, so here's the coccus. That's the sphere shaped. Bacillus is rod shaped and the spiral shaped here. And there's 3 different ways that they can show up. All right, notice these 2 have the same pairs and singles and then chains. And then this one forms clusters. This one forms flagellated bacilli, which kind of has like a little tail at the end. Spiral bacteria has like a life source of their own. So they have Borrelia treponema, which is short, and then this spirillum, which is like almost like looks like little worms. Okay, so this is colonies of streptococci. So you can see the round shaped. Okay, you can see that they have singles and doubles. You can see they're forming chains. All right. And then we have the staphylococci. You can see that they're forming clusters. Okay, so they look different on different, when they come up as different viruses. All right. So gram-positive and gram-negative bacteria. We have Hans Christian Gram, who was around between 18 and 1900s. He developed a 4-step staining process for separating bacteria into 2 groups. Right? Gram staining requires the sequential use of a crystal violet dye, iodine, alcohol, and saffron dye. The bacteria that are stained by the dye are classified as gram-positive. They appear dark purple under a microscope. The bacteria that are not consistently stained are classified as gram-variable. And then gram-negative come up pink or red. All right. And here's what something that has been dyed and is gram-positive looks like. You see how they're kind of a dark color. And this is gram-negative. You see how they're a red or pink color. Okay, so this dye that that Hans Christian Gram created or developed helps separate bacteria into these 2 separate forms. So we have gram-positive, again, that's a dark staining, and then gram-negative, which is like a light pink or red staining. All right, so bacteria are separated into other groups too. We have aerobes. Does that word look familiar to anybody? I don't know how old you guys are, but I'll tell you back in the 80s and 90s, I did a lot of this. Does this word look familiar? Like maybe another word? Maybe aerobic? Anybody ever do like aerobic exercise?
Yes.
So when you're doing it, you're breathing a lot. So that might help you to remember that this is a variety of bacteria that requires oxygen to grow. Okay. Or you can look at it and say aerobe, and it has word air in it, and that requires oxygen to grow. I'm just giving you like ways to remember these. If they help you, fine. If they don't, and you're a memorization person, go for it. Anaerobe is the opposite of aerobe. So that's bacteria that grow in the absence of oxygen. And these types of bacteria are destroyed by oxygen. Okay, so anaerobe, they can't have air or they can't have oxygen. And aerobe needs oxygen. The third kind is facultative anaerobe. This is an organism that can grow in the presence or absence of oxygen. What do you suppose is the hardest form of these bacteria to get rid of? Of these three?
Facultative,
Why?
because it can basically do whatever it wants.
Right? It can grow anywhere, right? It can grow with oxygen, without oxygen, like it's just growing. It doesn't. So this one, if there's no oxygen or you cut off the oxygen, we can get rid of the aerobes, right? The anaerobes, if we turn on the oxygen, we can kill them. But facultative anaerobes can grow anywhere, okay? So they are the harder point of bacteria to kill. Capsules, you guys probably recognize this word. Maybe you take something in the form of Tylenol or Advil and they come in capsulated form. And bacteria forms a similar thing around its cell wall. It forms a capsule or protective layer, all right, that covers the cell wall, all right? It's generally virulent. Virulent means, what word in virulent can you find similar to that word?
Virus.
Yes, virus, okay? And viruses are not good, all right? So that means it's capable of causing serious disease. The word virulent means capable of causing serious disease. All right, the capsule increases the bacteria's ability to resist the defense mechanisms of the body. So it's already this harmful substance, and now it's created a protective layer around itself to further stop the body from fighting it off. I'm sorry, my dog is a menace. Capsule may also prevent antibiotic agents from having an effect on the bacteria. Okay, so if there's something that can be cured by antibiotics, but the bacteria has created a capsule around itself, it's making it that much more difficult for it to be destroyed. So spores are the most resistant form of life known. Okay, everybody here works in a dental office, right?
Yes.
Okay, so when you guys clean or disinfect your rooms, did you ever take notice of the bottle you're using? It's probably something called Cavicide or Procide,
Yes.
and it's sporicidal. So what does that mean? Think about that word. This is why we can use it as a high-level disinfectant. If it's sporicidal, that means it's killing what? It's
Spores.
killing the spores, okay, which are the most resistant form of life known. I shouldn't say it's killing the spores, it's decreasing the amount, okay? Yeah. There is only one thing that can completely kill everything. Does anyone know what that is? And we will get to that later.
An autoclave.
Right, okay, and what is an autoclave? Sterilization, right? Sterilizing. Okay, that's what an autoclave does. It literally sterilizes. So when we wipe down our rooms, we can't sterilize our rooms, right? But we can disinfect our rooms. And we want to use a high-level disinfectant to bring down the number of bacteria and spores, okay? And so that's why we use a high-level disinfectant that is, sorry about my voice, sporicidal. Excuse me. Some bacteria change into a highly resistant form called spores. Bacteria remain alive in the spore form but are inactive. Spores represent the most resistant form of life known. It can survive extremes of heat and dryness, even in the presence of disinfectants and radiation. Harmless spores are used to test the effectiveness of the techniques for sterilizing dental instruments. So when you guys use your autoclave, you might not be in charge of doing this, but just hopefully somebody in your office takes these little packets once in a while and throws them in the autoclave to make sure your autoclave is working.
Yes.
Okay, those are harmless spores, and it checks the efficiency of your autoclave. Okay. Rickettsia is short, non-movable rods that normally live in the intestinal tract of insects. Okay, so if you see the word rickettsia, you want to remember insects. Lice, fleas, ticks, and mosquitoes. They're very small, require a host cell to reproduce. And diseases caused by rickettsia include typhus and Rocky Mountain spotted fever. It's transmitted to humans by way of the bite of an infected insect. That is the only way you can get it. Okay. These are things mosquitoes pass from person to person. Okay. So beyond this, there are, Rocky Mountain spotted fever is pretty severe, although not really around very much anymore. So algae, this should look kind of familiar from science class in high school. Where does algae grow? Only one place. On what? Water. Okay.
Oh my gosh, that's right.
So algae range from microscopic single cell organisms to larger multiple cell organisms such as seaweed and kelp. So if you see algae, you want to remember it grows on water. Seaweed, kelp, all algae contains chlorophyll. Chlorophyll, do you remember from class that like helps grow, turn green with the sunlight, as well as pigments that cause them to appear yellow, green, brown, or red. Algae are found in abundance in both freshwater and marine habitats, and most algae do not produce human disease. Okay. I would doubt there would be anything on your test about algae, but if you see something, remember it grows on water and it's really not very harmful to us. All right. Protozoa is a large group of single-celled organisms. Some can remain viable as cysts for long periods outside of their host. Most do not cause disease, but some live in hosts and do cause damage. A small number of protozoa are responsible for intestinal infections in human beings. Others invade the blood, lungs, liver, or brain. Again, an infection is caused when bacteria from one area goes to another area and causes chaos. Okay. Fungi, this should also look familiar. Does anyone know something that is fungi or fungi? I'll give you hints right here. Fungi is mushrooms, okay? They're plants such as mushrooms, yeast, and molds that lack chlorophyll, okay? Candida is a common yeast found in the oral cavity of about half the population. What is another way of saying candida? It's an infection in the mouth or genital area, but it's also called a blank infection. You guys are sleeping this morning. How about a yeast infection? Okay.
Oh, gee.
So candida in babies and when it's in the mouth is also called thrush. Has anyone ever heard of that? Babies get it from nursing, from formula, but it's a yeast infection found in the oral cavity. Okay. And it sits dormant. It's found in about half the population. All right. But it lays dormant. So it's not causing chaos unless you have an overgrowth of it. It's also found in the gastrointestinal tract, female genital, and sometimes the skin. Cross-infection may occur between mother and baby or among infant siblings. Oral candidiasis is caused by the yeast Candida albicans. All forms of candidiasis are considered opportunistic infections. What is an opportunistic infection? Let's talk about the three different infections. We have an acute infection. It doesn't mean it's adorable. What's an acute infection? The word acute comes up a lot in dentistry. So acute means very severe and happens quickly. Okay. A chronic infection is going to be something that is not severe and happens right away. It's going to be something over what? You're killing me this morning, guys. Okay, so chronic infection is going to happen over a long period of time. Okay, an opportunistic infection is an infection that occurs that normally could be fought off. But since the host is susceptible, maybe they are immunodeficient or they're elderly or they're really, really young, it causes an infection where normally your body could fight it off. So the infection sees an opportunity, okay, opportunistic infection. So it sees an opportunity to invade the host, all right? They are found in patients who are very young, very old, or very ill. So again, you're compromised, your immunity is compromised. And that's why, like, for example, we could talk about COVID. The majority of people that are being affected by COVID are people that are immunocompromised. Maybe they have HIV or some sort of autoimmune problem. The elderly, because they don't have the strength to fight it off. And same thing with babies. Okay. And that's going to be the same with the flu. It's going to be the same with any infection. If you are healthy and you are, take care of yourself and you're not a good host for an infection, chances are your body will be able to fight it off. I'm not saying 1,000% of the time, but for the most part. Okay. It's characterized by white membranes on the surface of the oral mucosa tongue and elsewhere in the oral cavity. Lesions may look like thin cottage cheese and can be wiped off to reveal a raw, red, and sometimes bleeding base. It looks like this. Okay, so this is what thrush looks like in the mouth. All right, it kind of looks like this white, filmy, sticky stuff. And when you wipe it off, this is what it looks like. Red, splotchy. All right, so if someone comes into your office and sits down in the chair with this, it is oral candidiasis or thrush or an oral yeast infection. All right. Prions are small proteinaceous infectious particles. They are composed entirely of proteins that lack nucleic acids. Nucleic acids are the center of your nucleus, which is like the heartbeat of the cell. That includes your DNA or RNA. Until the discovery of prions, it was believed that any agent capable of transmitting disease had to be made up of genetic material composed of nucleic acid. Once prions came along, they realized that you don't need the nucleus to transmit disease. This is transmitting disease in a completely different way. So what prions do is they convert normal protein molecules into dangerous ones by causing the normal ones to change their shape. So by doing nothing else but changing their shape, these prions are causing causing the cells to change. By causing the cells to change, they are producing serious infectious particles. Things that prions produce are like Alzheimer's, things that we don't have a cure for at this point. Parkinson's, most of the time we don't even have a test for them. So prions are a new and separate class, unlike bacteria, fungi, viruses, and all other known pathogens. So prions are pretty serious. All right. Prion diseases, mad cow disease. It's linked to human diseases such as Creutzfeldt-Jakob disease, which is a rare form of dementia, and possibly Alzheimer's disease. Prion-caused diseases have been found in human beings and animals. They are resistant to heat, chemical, and irradiation. And there is no treatment or vaccine against prion diseases. The only preventative measure is not eating suspect food, and that is for mad cow, not for dementia. We don't really know what causes dementia, and there is no cure for it. So that's why these diseases are so dangerous. Future research on prions, ongoing research to determine whether prions that consist of other proteins play a part in more common neurodegenerative conditions, such as Alzheimer's, Parkinson's, and amyotrophic lateral sclerosis. These three disorders have marked similarities. As with all prion diseases, these neuropathologic diseases occur sporadically, but sometimes run in families. They really don't know very much about these, okay? So there's ongoing research. with these diseases, but there is no vaccine, there is no cure. All right. And they're trying to find links to figure out whether or not they run from generation to generation. And they're starting to find some links with Parkinson's as far as where your heritage is from, but they're not 100% sure. Okay, viruses are much smaller than bacteria. Despite their tiny size, many viruses cause fatal diseases. New and increasingly destructive viruses are being discovered and have caused the creation of a special area within microbiology called virology. So if you see the word virology, it is, ology means study of, and then vir would mean viruses, so the study of viruses. Okay, virology. Viruses can live and multiply only inside an appropriate host cell. The host cells may be human, animal, plant, or bacterial, depending on what kind of virus it is. So the way that a virus works is a virus invades a host cell, replicates or like duplicates itself, make copies of itself, and then destroys the host cell so that the viruses are released into the body. All right. So it destroys the entire cell. It kind of moves in, brings its family, and then kills whatever was there to begin with. Right? Viruses can exhibit specificity or preference for particular cell types in which to replicate. And some other viruses are able to cause disease in more than one organ. All right. Some viruses can cross the placenta and infect the fetus as well. Some viruses establish a latent or dormant state in host cells. What does dormant mean?
Inactive.
Right, inactive. It just kind of hangs there, right? A latent virus can be reactivated in the future and produce more infective viral particles, followed by signs and symptoms of the disease. Stress, another viral infection, and exposure to ultraviolet light can reactivate the virus. HIV has a latency period of months to years. Hep C is known to have a latency period of 15 to 25 years. There's something huge that we see in dentistry a lot that has, that is a latent virus. Can anyone think of what that is? It happens right here.
Herpes?
Right, oral herpes, right? Herpes
Yes.
simplex 1.
Yeah.
Because it doesn't show up all the time, right? What brings it out? Literally stress, right? Sunlight. If you get too much sunlight, you can get an outbreak. So all these things bring out herpes simplex 1, and we see it a lot in dentistry. So that is a huge latent virus that we see. And there's definitely questions about that on the boards. I know that. Treatment of viral diseases. Viruses cause many clinically significant diseases in human beings. General antibiotics are ineffective in preventing and curtailing viral infections, and even the few drugs that are effective against some specific viruses have limitations. All right. The dangerous thing about viruses is that they are capable of mutation. So that's why every year you need to get a flu shot, because the flu is changing every year. Okay. The flu is a virus and there's more than one strain of it. So they kind of use their scientific methods to figure out which strain of the flu is going to be worse this year. And then that's the one that they give us. Okay. But they can't be 100% sure. You can get a flu shot and still get the flu. You might have a different strain of the flu. Or if you do get the flu, it won't be as severe if you've taken the flu shot. Right? It's very difficult to develop vaccines against viruses because of the ability of viruses to change their genetic code. All right, so this year strain A may be the worst, and last year it could have been strain Z, and every year it could be different because they keep mutating. All right, so you're never going to have the same. It's not like the flu is the same every single year. Symptoms may be the same, but it's not the same strain of the flu. Viral diseases are transmitted by direct contact. What does that mean, direct contact? As opposed to indirect. What is direct contact? It's literally person-to-person contact. Okay. And once we get into disinfection, we're going to really hone in on direct and indirect contact, but direct contact is person to person. All right. So you can catch a viral disease from direct contact with someone, like literally you touching that other person.
Excuse me.
Yes.
So can we go back to the PowerPoint and revisit it to take notes? Because I'm trying to take notes and I feel like I'm not fast enough.
Well, yeah, the PowerPoint's going to be on your Google Classroom too.
Oh, I apologize. Oh, that's
no,
great. Thank you.
Fine. So what I'll do is at the end, I will create a Google, at the end of today, I will create a Google Classroom. Any PowerPoints that we went over today or any ones we're going to go over, I'll put in there. I will also open up tests that you guys can take to practice, like practice tests. And you guys can contact me through there as well. So, okay.
Thank you. Thank you
Yeah,
so much.
Of course, of course. And this is all chapter 18 too in your MDA book.
Oh, wonderful. Thank
Okay?
you.
Yeah. All right. Yeah, I know. I talk fast. So, but we actually kind of have a lot to cover. So it's a kind of huge thing to cover in 2 days. So I know this is a really fast pace. That's why I open up the Google Classroom and make sure you guys have all the information so you can kind of look back on it. And I'll try to post all of these PowerPoints today. So if you happen to look over them and have any questions, ask me next week. All right. So you'll have kind of a whole week to, and you don't have to take the test that I open up. It's for your benefit only. Like you know, you're not going to get in trouble if you don't take them or get an F in my class because it's a review, but it is for your benefit. And it does really, really help to continuously take these tests to just reiterate some of the major points of infection control. Because it's not, I don't want to say it's the infection control board, not that it's not difficult, it just encompasses a lot of information. But if you understand the information, it's not a hard board to take. It's not like general chair side is tough. But this is not a hard board. It just encompasses a lot of information. So I want you guys to really understand the basis of it so that it will, because once you understand this part, everything else builds on it. So if you don't get this part of it, you're going to be lost everywhere else. Okay, so you'll see as we start to move on in our PowerPoints, we'll come back to some of the things that we talked about here and you'll be like, oh, I totally remember that. So if it seems like I kind of go off my PowerPoints a little, I am, because I know they're going to show up later too. Okay, so if you don't catch the notes here, you'll probably catch them in another PowerPoint, but they'll all be listed for you. Blood transfusions, those are obvious. They really don't, back in the 80s when HIV and AIDS came about, people were getting viral diseases from blood transfusions. They're really not getting them anymore. They're pretty serious about testing their blood. So, you know, that's not really an issue anymore. Mine? Give me 1 second, guys. Sorry. Sorry. Okay. Contaminated food or water and inhalation of droplets expelled by coughing or sneezing. Which do you suppose we have to worry about the most in dentistry? I know everything's changed in your office over the past few months. Okay, so this inhalation of droplets expelled by coughing or sneezing. Okay, we are literally on the front lines at this point in dental assisting. So that's why we're so severe in our, you know, PPE and covering ourselves and making sure we're, you know, okay and our patients are okay. Viruses are easily destroyed in the external environment. Chemicals such as bleach, iodine, phenol, and formaldehyde easily and effectively destroy viruses on surfaces and objects. These agents are too toxic to be used internally. Okay, regardless of what someone tells you, do not swallow bleach. It will not make you feel better. This I don't care about. All right, viral diseases. So we have viral hepatitis. There are 5 types of viral hepatitis. Each of them is caused by a different virus. Does anyone know the 2 that we worry about most in dentistry?
Hepatitis C.
C, and one other one.
And
I'll give you a hint. This other one we have to be vaccinated for.
B.
Yeah. Okay. B and C are the two we worry about in dentistry. And I'll show you why as we go through them. All right. So hepatitis A can affect anyone. It is spread from person to person, so direct contact when something is put in the mouth that has been contaminated with the stool of a person with hepatitis A. So the transmission is fecal oral. Why do we not really have to worry about that in dentistry? What do we wear in dentistry to protect ourselves from this?
PPE.
Yeah, we wear PPE, we wear gloves. We're not, even if somebody walks in and they've just gone to the bathroom and haven't washed their hands, right? We're not catching anything from them. Our mouths are covered, our hands, but mostly our hands are the problem, right? But we wear gloves. We don't touch patient without gloves on. So it's not really an issue in dentistry. Good personal hygiene, which hopefully most dental assistants also have, and proper sanitation. Again, dental assistants should have that. Can also prevent hepatitis A. Always wash your hands after changing a diaper or using the bathroom. It is the least serious form of viral hepatitis. A vaccine is available that provides long-term prevention in persons older than 2 years. Okay. Really, this disease, you have to worry about people who are living in unsanitary environments and children who are not really, even when they wash their hands, they go like this and they're not really washing them. Okay. So as they're learning to take care of themselves and get out of their diapers and learning to wipe themselves, like that's why, as parents, we stand over them. We're like, wash your hands, do the alphabet. But that's your main focus on this hepatitis A. And it's not really something that we worry about in dentistry. Hepatitis B, and you'll notice all the hepatitis, the middle letter is the hepatitis that it is. All right, so this is going to be HAV, because if you see this on the test, it might just say HBV. And if it does, that's hepatitis B, okay? Hepatitis B is a very serious disease that may result in prolonged illness, liver cancer, cirrhosis of the liver, liver failure, and death. Bloodborne diseases that may also be transmitted by other body fluids, including saliva. That's what makes this so dangerous, okay? Anyone who has ever had the disease and some persons who have been exposed but have not been ill may be carriers of HBV and may actually be spreading the infection to others. So even if you have a dormant case of HBV, you can still be spreading it, and it spreads through blood and saliva, which is what makes it dangerous in dentistry because we have saliva everywhere, right? This presents a high risk for dental personnel because dental treatments bring them into contact with saliva and blood. Hepatitis B immunization, I'm trying to remember, but I'm pretty sure it's a required, for people who vaccine, I'm not making any judgments. It's a required vaccination for small children now, but I know when I was growing up, it wasn't, because when I went into dental assisting school 20 whatever years ago, I had to get my series of Hep B shots. But I think now with children, it's one of the vaccines. This is a highly effective vaccine that's available to prevent hepatitis B. All dental personnel with a chance of occupational exposure should be vaccinated against Hep B. The OSHA Bloodborne Pathogen Standard, or BBP, all right, Bloodborne Pathogen Standard, requires that the employer offer the hepatitis B vaccination at no cost to the employee within 10 days of initial assignment to the position in which there's a chance of occupational exposure to blood or other body fluids. The employee has the right to refuse the offer of vaccination. However, that employee must sign a release form indicating that the employer did offer the vaccine and the employee understands the potential risk of contracting Hep B. I can't think of a good reason why anybody would sign that, although I did have a student one time who never finished her series. And I said, well, you have to start your series all over. And she's like, well, what should I do about work? And I was like, that's a personal, but it's so easy to catch if somebody comes in with it. I don't know that it's worth the risk. It's personal. There are people who don't want the vaccine, but in dental assisting, I can't think of a good reason why you wouldn't want it. But Hepatitis C, or HCV, is most efficiently transmitted through blood transfusion or percutaneous exposure to blood. What does percutaneous mean? Means under the skin, so like a needle stick, okay? It can recur as a result from an accidental needle stick injury to an employee in a dental office through the sharing of contaminated needles amongst users of injective drugs or through the use of contaminated tattoo needles. All right, that's why I don't know if anybody has tattoos or not, but if you go in to get a tattoo, they should be opening up fresh things for you. If they're not, they just take them out of the back somewhere. I would haul butt out of there because Hep C is, once you have it, is a terrible, terrible and painful disease. The carrier rate for HCV is higher than that of HBV. There is no vaccine against it, nor is there a cure for it. Treatments available to control effects of the disease, and the CDC guidelines now recommend a one-time HCV screening for all baby boomers. All right. You see some people that have HCV. You notice a lot of people that have been in prisons will get it because they get tattoos there, like stick and poke tattoos, and they're all sharing the same needle. So if one person has it, everybody gets it. So you do notice that a lot. Okay. People that were or are still drug users that share needles, but you can contract it from someone who has it just by getting poked with an instrument or needle. All right. So we do have to be super careful, make sure we use our proper techniques when we're cleaning, which we'll get to later on. Hep D, or HDV, is a defective virus that cannot replicate itself without the presence of HBV. So what is that saying? In order to get Hep D, you already need Hep B. So if you've been vaccinated against hepatitis B, what can you never get? You can never, well, you can't get Hep B, and you also can't get Hep D. All right, so that vaccination is a double doozy because you can't contract hepatitis D without already or also contracting hepatitis B. All right, therefore, infection with HDV may occur simultaneously as a co-infection with HBV or may occur in an HBV carrier. So even if you're just a carrier of HBV and you don't have any symptoms, you can still get HDV. All right, persons with co-infection often have more severe acute, there's that word again, disease and a higher risk of death than those infected with HBV alone. Vaccination against HBV also prevents infection with HDV. Okay. So again, if you've had your Hep B vaccine, Hep D is not something that you're ever going to have to worry about. Hepatitis E is not transmitted through bloodborne contact. It's most frequently transmitted by way of fecal oral routes through contaminated food or water. It's mostly seen in the form of an epidemic in developing countries, and it's not a major concern in the standard dental setting, okay? It's mostly through contaminated water. If you're drinking the same water you're bathing in, which is not really a serious problem in this country, but there are a lot of third world countries that where this is a major concern, okay? But we don't really have to worry about it. We have, you know, our water is relatively clean by the time we get it to our houses. If anyone even still drinks out of the faucet anymore, I don't know. So my kids told me the one day we were out of water and I was like, you guys aren't going to believe this, but see that thing over there where you push yeah, that's water. Like you can drink that. But, you know, it's a different world today. So, all right, herpes viruses we were talking about. There are a few types of human herpes virus. We have herpes type 1, which is oral lesions, otherwise known as, what do you call them? Some people call them fever blisters. Some people call them, say again?
I said cold. I'm
Yeah,
not
cold
sure.
sores, right? Because When they're getting them is when they're stressed out or when their immunity's down, when they get a cold. That's why they're called cold sores, right? Or fever blisters. When you get a fever and your immunity's down, they pop out. Okay. Herpes simplex virus 2 is caused primarily genital lesions. And then we have the herpes zoster virus, which causes shingles and chickenpox. We have CMV, which is normally latent, does not cause disease, but may become active when the immune system is damaged. Once active, it's highly contagious and transmitted through most body fluids. That's mostly seen in patients that are immunocompromised. So you'll see CMV in patients with an active HIV infection, something like that. Epstein-Barr virus is mononucleosis, otherwise known as the kissing disease. It's very easy to pass, and it's Burkitt's lymphoma is the same thing. It's a malignancy of your lymph nodes. Okay. So herpes simplex virus type 1 is a viral infection that causes recurrent sores on the lips. And we talked about the different types of infections, and we said this was a what type of infection? Do you remember the word that starts with an L?
Latent.
Latent. Okay, so this is a latent infection. Because these sores frequently develop when the patient has a cold or fever of other origin, the lesions have become commonly known as fever blisters or cold sores. Primary herpes. This disease, which is highly contagious, makes its first appearance in very young children, 1 to 3 years of age, and is known as primary herpes. The child may have a slight fever, pain in the mouth, increased salivation, bad breath, and a general feeling of illness. Inside of the mouth becomes swollen, gingiva are inflamed. So seeing the signs and symptoms of this, do you suppose a lot of it goes unnoticed? Because during this age, children are also teething, right? Yes. So they already might have a little fever. They might be complaining of pain in their mouth, increased salivation, saying they don't feel well. Gingiva are inflamed, right? So this could definitely be mistaken for teething, all right? So a lot of times primary herpes goes unnoticed in small children. The healing begins naturally within 3 days, and it's over in 7 to 14 days. Okay, so it could go completely unnoticed unless there's like a humongous outbreak. Supportive measures can be taken to make the child more comfortable, relieve the pain, and prevent secondary infection. Now, the problem with not knowing that you have herpes is it can lay dormant for years and years and years and years and years, and then all of a sudden you become like a grown-up and you're in this stressful job or situation or childbirth, and all of a sudden you have this outbreak of something you didn't even know that you had. Okay, because again, it can really go, the primary herpes can really go unnoticed in small children because it really replicates teething as well. All right, recurrent herpes labialis. After the initial childhood infection, the HSV lies dormant and reappears later in life as the familiar recurring fever blister or cold sore. So you could get cold sores and not even realize that you had them when you were little. You didn't necessarily get them from someone else. You may have had an infection when you were little and not even known it, or your parents might not even have known it. Okay. I think I read somewhere 80% of the population has this at this point. So it's not really unusual. Recurrences tend to take place when patients' general resistance is lowered due to stress, fever, illness, injury, or exposure to the sun. Use of sunscreen with sun protective factor 15 or higher helps to prevent sun-induced recurrences, and attacks may recur as infrequently as once a year or as often as weekly or even daily. And there are medications at this point that you can take to help curb that, although nothing cures it. Okay. This is what it looks like, and this is what it looks like when it's healing. The problem is when it's like this, some people don't even notice they have it. That is when you can spread it. Okay. If you see someone with this, chances are you're going to stay away from it. All right. So you really have to as dental assistants, because we're around the mouth, we really have to use our eyes, really have to wear our PPE. Okay. Because it can be spread through aerosol. Okay. So we really do have to be careful. Herpes simplex virus 2 is genital herpes. It's one of the most commonly sexually transmitted diseases in the US. The initial symptoms generally appear 2 to 10 days after infection: tingling, itching, burning sensation during urination. Once a person is infected, outbreaks will occur. Disease can be transmitted only during recurrences. So if you're someone who happens to have this, if you're not in an outbreak, you can't transmit it. However, just like the simplex 1, you need to know when you're about to have an outbreak, okay? A mother with active vaginal or cervical herpetic lesions at the time of delivery can pass the virus to her newborn. So if you are a mother that has this, very important that you tell your OBG. And if you have an outbreak, because again, it's a high stress situation when you're having a baby, your body is completely stressed out. You could have an outbreak. You are better off letting your doctor know, and if necessary, having a C-section. Okay, other herpes viruses. Herpes zoster virus causes both varicella, which is chickenpox, and herpes zoster, which is shingles. Chickenpox is the primary infection. Zoster represents reactivation of the illness. So again, now children get immunized for the chickenpox, so they don't get it. When I was a kid, like when my sister got it, my mom's like, okay, everybody in the room with your sister. Like we all got it at the same time. So, now they're doing things a little differently, because what's happening is later on in life, if you get shingles, it's extremely painful. It's very, very painful. Again, CMV can affect the fetus during pregnancy, and Epstein-Barr is responsible for infectious mononucleosis, nasopharyngeal carcinoma, lymphoma, and oral hairy leukoplakia. These aren't things that we really worry about in dentistry, but it's good to know all the different areas of the herpes virus and what it can cause, all right? Because they're all coming from the same basic virus. Major transmission route for herpes virus is through direct contact with lesions. In other words, you touch a lesion, okay? That can be, so if it's oral, it can be touching a patient without gloves on that has an outbreak. It can be kissing your partner who has an outbreak. Even when there are no active lesions, there's still the possibility of transmission of the virus through saliva or aerosol spray from the dental handpiece. So, because there is no preventative vaccine against herpes, it is essential that precautions be taken to prevent exposure. Protective eyewear is important because a herpes infection in the eye may cause blindness, and gloves protect against infection through lesions or abrasions on the hands. Okay, all of our PPE are worn for a reason. They're all important. Any mucous membrane that the herpes touches can have an outbreak on. I've seen people with an outbreak of herpes on their eyes. It's horrible. It can cause blindness. Wear your goggles, wear your shields. It's important because it can be transmitted through aerosol spray from the handpiece. Okay, so even if a patient is recovering, it can still be sent to you. So you have to be careful. West Nile virus is commonly found in Africa, West Asia, and Middle East, although it had a stint here back in the summer of '99. I don't know if anybody remembers that or not. It's carried by mosquitoes, which means it's can infect human beings, birds, horses, and some other mammals. It affects a person's nervous system, causing inflammation of the brain and spinal cord. Symptoms include fever, headache, tiredness, aches, and sometimes rash. Occurs primarily in late summer or early fall when the mosquitoes are out. Okay, this isn't really something that we worry about now. I believe it had its moment in the sunlight back in '99, and I haven't heard about it since. So, but again, you want to try and protect yourself. So, swine flu, again, this was made a debut back in the early 2000s, I believe, and then we haven't heard about it since. It's not related to previous or current human seasonal influenza viruses. The new H1N1 virus spreads easily from person to person. The most effective way to protect yourself is receive the vaccine and practice meticulous hand hygiene. If you want to know more about it, there's the website. Ebola is rare but deadly. It causes bleeding inside and outside the body. It first occurred in 1976. It killed up to 90% of the people who are affected. That's a huge number. It's spread, here we see again, through direct contact, okay? With blood and body fluids, a person infected with Ebola is not considered contagious until symptoms appear. All right, again, not really something that we, if somebody is infected with Ebola, chances are they're not in the dental office, but it's good to know, about the virus. Guidelines for dental professionals on the Ebola. It's highly unlikely that someone with Ebola will seek dental care when they are severely ill. CDC and ADA Division of Science advise dental professionals to take a medical history, including a travel history from their patients. Any patient who has been in West Africa in the past 21 days should reschedule. Okay. That's all about every patient that comes in, you should do an updated health history on. Always, always, always. Zika virus, again, this was around for a minute, spread to people primarily through the bite of an infected mosquito. Most common symptoms include, they're all like the same: fever, rash, joint pain, and conjunctivitis. People do not usually get sick enough to go to the hospital. They rarely die. It can be spread from pregnant women to fetus, which has been linked to a serious birth defect called microcephaly. So as long as you're seeking doctor's care when you're pregnant, this should not be an issue. Bacterial diseases include, but are not limited to, tuberculosis, Legionnaires, tetanus, syphilis, and methicillin-resistant Staphylococcus aureus, otherwise known as MRSA. Okay, these are all bacterial diseases. Now we'll talk about them one by one. Tuberculosis is caused by the bacterium Mycobacterium tuberculosis. It's the leading cause of death resulting from infectious disease worldwide to date. HIV and tuberculosis are often present together. Of the two diseases, tuberculosis is a greater health risk for healthcare workers. There's something called the tuberculosis kill time. This is the benchmark for the effectiveness on a surface disinfectant. Okay, so if you read the bottle of the disinfectant that you're using at your job and it says 3-minute tuberculosis kill time, that means it needs to stay on that surface for 3 minutes. It says 5 minutes, same thing, okay? This is one of the things we're trying to kill, so it'll say tuberculocidal on the side of the jar. And once you guys go back to work and you look, you'll be like, oh, look, there's sporicidal, there's tuberculocidal. So you'll see them all on the side of your disinfectant. Okay. Legionnaire's disease, Legionella pneumophila, causes 2 acute bacterial diseases, Pontaic and Legionnaire's. Bacteria are transmitted through aerosolization and aspiration of contaminated water. There is no person-to-person transmission, so it is not direct contact. Okay, it is indirect contact. Dental personnel have higher titers of antibodies against this than the members of the general public. Why do you suppose that's the case? So this is transmitted through aspiration of contaminated water. Where are we in the dental office going to find this contaminated water? More than other places.
Where we sterilize our instruments.
Not when we sterilize our instruments. What runs water all day long?
The autoclave.
The autoclave doesn't run water. What runs water? Think about when you're sitting in the chair across from your doctor. How about our
The drill
handpiece?
or the Cabotron?
The Cabotron, the drill, the air
Are you
water
speaking-
syringe, okay? This disease or this lives in the dental water lines. Okay, so that's why it's important every time you put your handpiece on to run your handpiece, right? It's important to run your water lines when you come in, especially between patients 1000%, but especially on a Monday after the water lines have been sitting all weekend. okay? Because bacteria, which we'll learn about that too, builds up in water lines in the form of like a biofilm. Think about your hose that you run at the beginning of the season, how this like giant thing of slime comes out of it. That's what lives in dental water lines. So it's important to run it between patients. It's important to run it every Monday morning. So that's where it's coming from. So when it says dental personnel have higher titers of antibodies, what does that mean? We have been exposed to
Our
it more
bodies are
than the
better at
normal
fighting.
person. So our body has developed antibodies to it, right? So chances that we're going to get this disease are not very high because our body already knows it and has developed titers against it or antibodies against it, okay? But the regular patient in the dental chair, if we're not running our lines and we're not cleaning our lines sufficiently, they have a higher risk of getting something like this, okay? Our risk is lower, their risk is higher. But of course, one of our main concerns is to protect our patients, okay? This is what bacteria looks like inside the dental unit water lines, and it builds up between patients, it builds up overnight, it builds up over the weekend, okay? Tetanus is also known as lockjaw, all right? It's an extremely dangerous and often fatal disease caused by spore-forming bacillus. Again, spores are what? The most resistant form of life, okay? So if it's a spore-forming bacillus, this is going to be pretty hard to cure, pretty hard to get rid of, okay? It's found in soil, dust, or animal or human feces. This microbe is usually introduced into the body through a wound or break in the skin, such as a puncture wound caused by a soiled instrument. The disease can be prevented by the administration of a vaccine. However, immunity must be kept current through booster doses. So probably all of us at one point or another, I hope all of us have gotten tetanus shots. And you do need to get a new tetanus shot once, I think it's every 10 years, it might be less. But if you step on a rusty nail, if you get bit by a dog, if any of these things that you don't know if it's clean, then they'll take you and either give you another tetanus shot or test to make sure your tetanus shot is still up to date. Okay. So try and make sure your shots are up to date. Syphilis is a sexually transmitted disease caused by Treponema pallidum spirochetes. Again, spirochetes were the spiral-shaped bacteria. They look like little snakes. Bacteria are often quite fragile outside the body, but can cross-infect the dental operator through contact with oral lesions. Syphilis does not just live in the genital area, it also lives in the mouth. Any warm, wet environment is a great place for it to rear its ugly head. The first stage of syphilis is a painless ulcerating sore known as a chancre, which is infectious on contact. Okay. Don't ever touch a patient without gloves, ever, 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 but don't ever do it. And if they have a sore that looks like the next slide I'm going to show you, definitely don't do it. All right. The third stage, known as latent syphilis, again, latent means dormant, is usually fatal and may occur after the disease has been dormant for 20 years. This is what syphilis looks like. Okay. I mean, if I saw something like this, I would send my patient home. Same thing with this, same thing with this. But it may not be this, you know, actually, this one is healing. All right, even though it looks horrifying. These are the first stage. It's an ulcerated, that's the chancre right here. Okay. This is the second stage of the chancre where the blister is broken. Methicillin-resistant Staphylococcus aureus, otherwise known as MRSA, is a... Good morning. Okay. A bacteria that is resistant to some antibiotics. This type of Staphylococcus aureus has evolved due to the excessive use of penicillin antibiotics over the years. MRSA infections can be on the surface of skin or can go into the soft tissue and form a boil or abscess. If you've ever seen anyone with MRSA, it is, if you thought this was a bad looking sore, I don't know if I have a picture here of MRSA, but it's horrifying. Okay. And this is, this disease runs rampant in the ICU. Okay. But just like this Legionnaire's disease, if we got tested for it, we have a higher number of antibodies. With MRSA, if you tested all of the nurses that work in the ICU, they would probably all test positive for MRSA because they have the antibodies, because they're around it all the time. So they become immune to it, but they would test positive for it because of the antibodies they have. Okay, that is why doctors nowadays don't prescribe as much penicillin as they used to. They're not as quick to, write someone a prescription. The reason MRSA is so scary is that you cannot cure it with just a regular antibiotic. You literally need to be hooked up to antibiotic IV for days in order to cure this. Okay. Always maintain good hand hygiene practices. Never squeeze or try to drain a sore. Keep wounds covered until they're healed. Do not share personal items such as towels, razors, sheets, and clothes. Okay. If you have a MRSA infection, please don't let anybody else near you, not children, not partners. Okay. Because it is very easy to spread. Pandemic diseases. This was actually written before COVID, but I find it interesting that it's in here because we know so much more about it now. It's a global disease outbreak. A pandemic occurs when a new virus or disease emerges for which people have little or no immunity and for which no vaccine is available. In addition to illness and death, and especially severe influenza pandemic may cause severe disruption resulting from school and business closing and interruption of public transportation and food services, which is literally what just happened to us. Okay. And this was written in 2018, so there's no way they could know that then. So, I don't want to say it was expected that this would happen, but, it did. So, we know what we need to do today to try and keep ourselves safe. So continue to do what you're doing. Does anyone have any questions about this chapter? I know this is a tough chapter to get through. It's very scientific. And again, there's no kind of easy way to explain it or learn it. It's kind of memorization, but I'll keep reiterating it and going over it. And the way that I am, if I hear something over and over and over and over, it starts to stick. That's how I learn. And a lot of these things are going to continue to come up in other chapters. So when they do, I will, reiterate this chapter as well. Okay. All right. So I don't know how you guys feel because you're all kind of quiet with me, but the way I like to do things is after I go over a chapter, I kind of like to do a little quiz on it to make sure that we understand everything we went through. So if you guys are cool with that, that's how I'd like to do it. And it usually helps my students to kind of reiterate what we just went over. Okay. Let's see. But you all have to pitch in because I already know the answers. Your session has expired due to inactivity. Interesting. I don't know why my session expired. If we do this one and you guys aren't into it, we don't have to do this. But again, I think it kind of reiterates what we learned. So, but I need kind of everybody to jump in. All right. Okay. Bacteria that are stained by Graham's dyes are anyone? Guess?
Positive.
Gram positive. Okay. I'm going to put down the answers that you guys tell me, and then we'll go over them at the end. They're not long. This is like I don't know, 12 questions or something. They're short. Okay. Rod-shaped bacteria are called
C.
as in boy or
Uh-oh.
yeah? Okay. Say B as in boy or C as in cat, because I'm sorry, I'm deaf today. The most resistant form of life known are
Spores.
spores. Viruses are capable of
All of the above.
factors that influence the disease-producing capability of a pathogen include. Let's break this up because you might look at this and be like, skip. Okay, factors that influence the disease-producing capability of a pathogen. What is a pathogen? Well, we know pathogens aren't good, right? It's saying right here, disease-producing, right? So a disease-producing capability of a pathogen. So what factors influence this pathogen? Can host resistance? What is host resistance?
Would that be like antibodies?
It can be antibodies and it can also be your general health, right? If your health is bad, if your immunity's down, if you're sick because you're not taking care of yourself, if you're not sleeping, that's host susceptibility, okay? So host resistance, virulence, what's virulence again?
Viral. I don't know.
It does have the word virus in it, okay? So virulence is the severity or the virus producing agent in it of the pathogen. Concentration of the pathogen, okay, which would be how much of it is there. So all of those things taken into account, which do you think would be a good answer?
D.
All.
All of them?
Yeah.
Try it. Bacteria that require oxygen to grow are known as
A.
aerobes. Blank are chain-forming cocci.
C.
Candida is a type of
A.
Fungus.
Fungus.
B, A.
Oh God. I think
A.
it's B.
For me, it's A.
I heard 1A. Does everyone agree with A?
Yeah.
Who was the Dutch merchant and amateur scientist who used primitive microscope to observe stagnant water? So let's back up. We know that there's Koch postulates. Do you remember?
Hmm.
So even if you don't remember what they are, you know it had nothing to do with probably a primitive microscope, right? What about John Lister? What is his name telling us? Lister.
I don't even remember his name.
You don't remember his name? I always remember it because of Listerine, but
That's a good way to see it.
I mean, yes. Okay. So primitive microscope. So it's going to be one of the earlier people that we heard.
Would it be Tyndall?
Let's try it. What I try to do in tests, I happen to be a really good test taker. Okay. So there's a formula that I use to take tests. And one of the things, if you can stop and take some of the answers out, it's a lot easier to make an educated guess on 2 answers than it is to make an educated guess on 4. So if you don't know the answer to something and you stop and back up and try to knock out the ones that 1000% would not work, you can usually knock out 1 or 2 and make an educated guess on the other 2. So again, with your test, if you come across an answer that you're like, what? Then sometimes that makes it easier for you. Okay. These names, you kind of have to memorize them. All right. There's not really much getting around them, but we'll continue to go over them. So hopefully they'll stick in your brain. Who was the English surgeon among the first to recognize the role of airborne microorganisms in post-surgical infections? Make an educated guess.
A.
Hmm?
I said A.
A?
I don't know.
Who was responsible for the development of the rabies vaccine? Well, let's put it this way. We've already used Tyndale, Leeuwenhoek, so that leaves us 2, right? If that helps.
I guess John Lister.
Okay, the major groups of microorganisms include
All ado. E.
E, all of the above. Which of the following statements is not true about bacteria? Usually pathogenic bacteria cannot grow at 98.6 degrees. Is that true or not true? Or you're not sure and move on?
It's not true.
A.
A is not true? Because
Yeah.
what is 98.6 degrees again?
The average temperature of the human body.
Right. Okay. So and are they one-celled microorganisms that vary in shape?
Yes.
Yes. Are they beneficial and protect human hosts by aiding in metabolism? A bacterial infection can be spread by any means of transmission.
Yeah.
Okay. A spiral-shaped bacteria are called
B.
spirochetes. It literally has the word spiral in it, so that's easy to remember. Organisms that can grow in either the presence or absence of oxygen are called
C.
what?
B.
I
B
think
as in
it's
boy?
C.
C.
C as in cat?
Yes.
Okay. Oh my, sorry, I'm really having a hard time hearing. The diseases typhus and Rocky Mountain spotted fever are caused by. How do we contract them?
A. E.
What? What was it? A?
A.
A, rickets A. Right?
Rickets.
How do we contract them? Through mosquitoes or bites,
Insect.
right?
Yeah.
Which of the following statements is true about chlamydia?
I don't think it's all of the above.
You do think it's all of the above?
No.
Okay.
I think it's B.
B.
Play a
B.
role in sexually transmitted diseases. The West Nile virus is carried by.
A.
A. Right?
Of the following, which will help prevent the spread of the swine flu?
D.
D is in doctor.
Mm-hmm.
A pandemic disease is one that.
All of the above.
All the above. Legionnaire's disease is spread from person to person by contact, thrives in water, is transmitted by aerosolization and aspiration of contaminated water, or both B and C.
Isn't it? Because the other one was supposed to be C, so I think this one's A.
The other one was supposed to be C. Wait, what?
Wasn't one of the other diseases specific to water?
So do you remember Legionnaire's disease and dental assisting we talked about? We have a higher titer of these antibodies.
It says comparison.
I think
I think
So
it's
it's
B.
D.
D. D and C.
It is I'm just going to tell you it's not spread by direct contact, right? How's it spread?
By what? Water.
Indirect. Water, by water. Viruses requiring a living host cell to live and viruses require a living host cell to live and multiply.
True.
Well,
False. True or false?
True.
True. Protozoa are capable of surviving free in nature. Untrue, false, you got to make a guess if you don't know.
False.
Don't worry, you're not really being graded on this. Most algae have the ability to produce serious human diseases.
False.
Where does algae grow again?
Water.
And it takes up things like what kind of things are algae?
Seaweed, kelp.
Yep, kelp, seaweed. Okay. The OSHA bloodborne pathogen standard requires that an employer offer the Hep B vaccine at no cost to the employee within 10 days of initial assignment to a position in which the employee may occupationally be exposed to blood or other body fluids.
True.
True.
All right, let's see how we did. 72%. All right, let's see what we got wrong. Okay, viruses are capable of mutation, okay? Viruses cannot replicate themselves. They can't resist efforts to kill them. They don't invade a host cell, okay? Viruses are capable of mutation, all right? You know, I'm gonna say, hold on a second. I don't believe that. Hold on. I don't know if that's right.
I'm gonna say, I feel like, yeah, that was,
I don't
because
think
one of
that's
those
right.
notes in your PowerPoint was viruses invade, replicate, and
Yup.
then,
I think that's wrong. I'm like, wait a minute. As I'm saying this out loud, it doesn't even sound right.
I feel like that's their thing.
Hmm.
I feel like that's their thing.
Now I'm being tested. Let's see. I'm looking in the book right now too. Yeah, viruses definitely invade the host cell. Let's see. Viruses cause fatal diseases. They can live and multiply only inside appropriate host cell. The host cell may be human. Virus invades a host cell. Yeah. Okay. So that they are incorrect. All right. It happens. Candida is a type of fungus. This one they are correct in. Okay. So fungus is a mushroom, a yeast. Okay. So it is a type of fungus. All right.
Okay.
Yeah. And if you look on page 264 in your, if you guys have the book, do you guys have this book? If you don't, that's okay.
I don't have it yet.
Okay, no worries. But if you do have it and you look on page 264, it says Candida is a common yeast that is found in the oral cavity of half the population. Okay. So, and that's under fungi.
Okay.
Who is the Dutch merchant? It is Antony van Leeuwenhoek. So how I would deduce this is they said in the sentence who is a Dutch merchant. If I didn't know the answer to this, I would have looked at the names and thought it was him anyway because of his name. That's how I would have known, but if I didn't already know that. But let's look him up real quick. Where are you at, babe? For pioneers in microbiology, Antony von Leeuwenhoek was a Dutch merchant and amateur scientist that used a primitive microscope to observe stagnant water and scrapings from the teeth. Okay, so that's Antony von Leeuwenhoek. So, post-surgical infections happened later on, and this was actually John Lister. All right. So he, and again, if you're in your book and you're looking under pioneers on page 260, you'll see Joseph Lister was an English surgeon who recognized the role of airborne microorganisms in post-surgical infection. Okay. He lowered the risk of infection after surgery. So I always think, I don't know why I think of this, but I think of Listerine when I think of him, and how Listerine like lowers the microbial count in your mouth. So he helped to lower the risk of infection after surgery. That's how I always remembered it. But who was responsible for the development of the rabies vaccine? That was Louis Pasteur. Okay. He pasteurized milk, and he is responsible for he's known as the father of microbiology, and he prepared the first vaccine for rabies. Okay. And that is on page 261 if you have your book. All right. So again, these guys, there's no kind of way to get around the fact that you kind of just have to memorize them, because if they ask a question about it, I mean, there's going to be maybe one question on the test about one of these guys, but if you can memorize them, that would, you know, help you out with that question. The major groups of microorganisms, you are correct, all of the above. Which statement is not true about bacteria? Yes, pathogenic bacteria can grow in 98.6 degrees. We know that because that is our body temperature. Okay. Spiral shaped are called spirochetes. That's correct. An organism that can grow with or without oxygen is called facultative. All right. Aerobe is with oxygen. Anaerobe is without oxygen. Facultative is either. Okay. Rickettsia is the is in insects causing typhus and Rocky Mountain spotted fever. Which of the following statements is true about chlamydia? Let me find chlamydia in here so I can. Herpes, 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 West Nile, H1N1, Ebola, Zika, tetanus, Legionnaires, syphilis. Look this up in the back of the book because I don't even see it in this chapter. Once in a while, they throw a question in there that I haven't even found. Let's see. Let's see. STD. I don't see this back here. Hepatitis, viral hepatitis, HPV, CDC, Hep C, Hep E, HIV. actually going to call false on this one. Trachoma. Let me see if that's in here. I feel like this wasn't in this chapter.
Yeah, I don't remember going over it.
I don't remember seeing it in the chapter either. Let's see. Let's look up trachoma because it's not even. Yeah. It's not even literally in the book. So we're going to go past this and say they play a role in sexually transmitted diseases was correct because they didn't give us any other information about it. Okay. That's only, and we only know that because we know it, right? Because we've heard of chlamydia before. All right. West Nile virus is carried by mosquitoes. That's correct. Of the following, which will help prevent the spread of the swine flu? A and B, hand hygiene and vaccination. All right. A pandemic is all of the above. We've seen that. Legionnaires, again, we talked about this. It thrives in water and is transmitted by aerosolization. Okay. It is not spread by direct contact. It is spread by indirect. Viruses require a living host to live and multiply. That is true. Protozoa are capable of surviving free in nature. If you have your book and you go to protozoa in here on page 264, protozoa consist of large group of one-cell organisms that do not have a rigid cell wall. They're found in freshwater and marine habitats and in moist soil. Their diet includes bacteria, algae, and other protozoa. Some can remain viable as cysts outside of their host for long periods of time. Okay. The thick walls of the cyst make them resistant to drying. All right, so the answer to that one is true. Most algae have the ability to produce serious human diseases. That is false. And the OSHA BBP requires that employee does offer you your Hep B series free of charge within 10 days of you getting a job there. Okay, any questions? All right, did you guys feel like this kind of wrapped some stuff up for you or helped you remember? If not, we, like I said, we don't have to do it, but I also feel like it breaks up. Like, I can't listen to myself talk for that long. I mean, I can, but I get bored. All right. Let's move on to chapter 19. Okay, this is a long one. So disease transmission and infection prevention. All right, this is gonna kind of sum up that last chapter and move us into infection control. So this is a pretty important chapter, okay? The dental assistant is at risk of exposure to disease agents through contact with blood and other potentially infectious materials. By carefully following infection control and safety guidelines, you can minimize your risk of disease transmission in the dental office. If you guys have any questions, stop me, because like I said, some of the things that I'm going to be telling you, since so what do you guys take an infection control course and then this is your review?
Yes.
Okay. But some of the things that you do in your office might not be exactly the same. Okay, so stop me if you have any questions, pretty please and thank you. All right. Okay. Chain of infection is super important. Okay, it consists of 6 links. We have the infectious agent. We have the reservoir. We're going to talk about each of these. Portal of exit, mode of transmission, portal of entry, and susceptible host. You see some things are crossing over already, right? And you're going to notice that a lot in dentistry. You're going to notice a lot of crossovers, okay? So things that we just talked about, we're going to see again. And as I keep reiterating them, they're going to become more and more part of your area of knowledge, okay? So this is what the chain of infection looks like. Breaking the chain of infection. I want to talk about in great detail. So we start out with the infectious agent. We move on to the reservoir, portal of exit, transmission, entry, and host susceptibility. All right, so we're going to talk about these one by one. The infectious agent. For us to have the chain of infection, we need to have an infectious agent, right? No infectious agent, no chain of infection, no worry about infection. All right, so a pathogen must be present, either bacterium, virus, fungus, parasite, prion, and the organism must be virulent. Again, virulence is the degree of pathogenicity or the strength of the organism in its ability to cause disease. Okay, so virulence is going to be the strength of the organism to cause disease. All right, so in order for us to have a chain of infection, we need to have this infectious agent. Is there a way to break this infectious agent? So if we're talking about the chain, all right, can we break the chain at the infectious agent?
No.
No, it's either there or it isn't. If it's there, it's there. We can't break that part of the chain. That's the only part of the chain we can't break. All right. So if the infectious agent is there, if somebody comes in with an infectious agent, if one of your patients has HIV or Hep C, you can't do anything about the fact that they have it. Okay, so we can't break the chain there. All that's telling you is that there is a pathogen and that it is virulent or it can cause disease. Okay. Reservoir is a place where microorganisms normally live and reproduce. Examples are humans, animals, food, water, bioburden, and contaminated surfaces. So reservoir is the place where they live. Okay. So we have the infectious agent. We have the place where the infectious agent is living. Can we stop the chain of infection there?
Yes.
Yes. How do we do that? It's right here in case you want to know. Okay, we can maintain excellent hand hygiene through thorough cleaning and disinfection of contaminated surfaces. This will minimize the reservoirs for microorganism. Okay, if somebody comes in with Hep B and they touch the counter, but we clean the counter, we have stopped the chain, right? You can't catch what you have removed. Okay, if your patient comes in with an infectious agent and we're, wash our hands. So even if we touch something, let's say they, touch the counter and we washed our hands, have we stopped the chain? Yes, right?
Yeah.
It's no longer on our hands. Portal of entry. All right, so to cause infection, a pathogen must have a portal of entry or means of getting into the body. The portals of entry for airborne pathogens are mouth and nose, and actually eyes too. Any mucous membrane, okay? Bloodborne pathogens must have access to the blood supply to gain entry into the body. This occurs through a break in the skin caused by a needle stick or cut or even a human bite. Can also occur through mucous membranes of nose and oral cavity. How do we stop? Can we stop this chain, part of the chain?
No.
Yes.
Oh.
Yes.
The masks and
The
glasses.
only part of the chain we can't stop is the infectious agent. I'll give you that hint. Okay. Yes. So can we get something on us if we're wearing a mask and goggles? Can we get airborne pathogens? No. So our what's the word I'm looking for? Our break in the chain is our PPE. Okay. Wearing our PPE is going to break the portal of entry. If we're cleaning our rooms and we're wearing utility gloves, which we're supposed to be wearing, and they're thick gloves, what are the chances we're going to stick ourselves?
Very little.
Slim.
Yeah.
Okay. So if we are using proper PPE to do our jobs, we can break that chain or that link of the chain. Okay. Susceptible host. Susceptible host is a person who is unable to resist infection by the pathogen. An individual who is in poor health, chronically fatigued, under extreme stress, or has a weakened immune system is more likely to become infected. Can we stop this part of the chain? Yes.
No.
Yes.
Oh yeah.
How do we stop ourselves from being a susceptible host?
Vaccination.
Vaccination. How else? Stay healthy.
Good.
Get enough sleep. Keep yourself healthy. Get immunized, right? So
Yeah.
staying healthy, washing hands frequently, keeping immunizations up to date will help members of the dental team resist infection and stay healthy. If we're not susceptible to catching what you have, we're not going to catch it. If someone comes in with Hep B, are we going to catch it?
No.
No, because we've had our vaccinations, right?
Mm.
So that's making ourselves a not susceptible host. All right. If we're wearing our PPE and you have a herpes simplex 1, are we going to catch it?
No.
No, we're going to keep ourselves healthy. We're going to keep ourselves covered. We're not going to be a susceptible host. Okay. So you can break that chain. All right. I don't know why they skipped over portal of exit. Okay. How about the portal of exit? So the portal of exit is going to be how it comes out of the patient, right?
Mhm.
So can we break that chain, that link in the chain?
No.
Yes. The only link we can't break is the infectious agent.
Sure, agent.
Okay. So how do we break the portal of exit? Oral rinses for the patients when they come in, right? We make them do rinses. They rinse out with peroxide. We can have the patients wash their hands when they come in, and we can make sure that we are covered for ourselves. So nothing is going to come out of the patient if we don't allow it, right? We're going to protect ourselves. We're going to use high volume evacuations, right? Suction. So even if the patient has something in their mouth, we're not going to let it get anywhere because we're going to stop it with our suctions, with our saliva ejectors. Okay. So we are stopping that portal of exit. Okay. So we actually talked about these already. So this should be a little bit of a review, but an acute infection, again, is going to be severe and appear soon after the initial infection. Okay, so if someone has an acute infection, it's going to be very severe and occur right away. Chronic infection is going to be over a what?
Span of time.
Long period of time, okay? Sometimes for life. And a latent infection, again, is going to be something that is persistent but comes and goes, okay? So oral herpes and genital herpes are latent viral infections. They're not always present. They're always present, but they may be laying dormant. Okay. So they don't always rear their ugly heads, but you always have them. They just lay dormant. Okay. We talked about this too. Opportunistic infection. Do you guys remember when we talked about that? What was that? I don't care if you cheat. It's right here.
It's wrong place, wrong time. Just people who didn't have, whoever.
Kind of. So
decreased.
it has to do with, again, with host susceptibility. Okay. It's caused by normally non-pathogenic organisms, and it occurs in individuals whose resistance is decreased or compromised. Okay. So it's the normally non-pathogenic organism sees an opportunity, I don't know what I just said, an opportunity to infect because your resistance is down or the host resistance is down. Okay, so you can't help if once you have something, you can't help that you have it, right? Like you can't help if you have HIV, but what you can do is keep yourself healthy to the best point that you can, taking care of yourself, making sure you get enough sleep, okay? But very old, very young, infections may see them as opportunistic infections. Okay. And they may cause infection, whereas in a normal, healthy person, we would be able to fight it off. Okay. So we started to talk about this too. We have direct transmission. Okay. Direct is person to person, occurs when someone comes into direct contact with the infectious lesion or infected body fluids. All right. That's going to be direct from your infection to my finger. Okay. Direct, person to person. All right. Indirect involves the transfer of organisms to a susceptible person through a contaminated instrument or a contaminated surface. Then you take that and touch your own face. Okay. So the person who has the organism or bacteria is touching, let's say, a surface, and then you're touching the surface, and then you're touching your mouth. How do we stop indirect transmission? How do we stop indirect transmission? So indirect transmission is going to occur from a contaminated instrument or a surface. How do we stop it?
Proper PPE.
Infection control and PPE, right?
Yes.
How do we stop direct transmission?
You did.
PPE. We are never going to touch someone in our dental chair without our PPE on, right? You're not going to touch somebody's cold sore with your finger. Okay, but we're going to wear gloves. We're going to wear our PPE. So we can stop direct, we can stop indirect. Okay, and it's our job to do that. So here we see how pathogen can transfer. You see how they have barriers. You see how they're wearing proper PPE. They have gloves, they have mask, goggles, and a lab jacket. Okay, they're using a high volume evacuation system. And they're collecting as much as they can so that they keep themselves protected. Okay, because the patient doesn't have to worry about getting something from his or herself. Okay, it's us that need to worry about it. All right, it's us that need to worry about direct and indirect transmission. All right, it's not the patient. So modes of disease transmission, we have airborne transmission, also known as droplet infection. This involves the spread of disease through droplets of moisture containing bacteria or viruses. All right, now a droplet you can see, right? Like somebody spits at you, not on purpose, but when they're talking, okay? That's airborne transmission. Aerosols, sprays, and spatter, okay, is what we worry about. If you guys wear a shield at work, or goggles, and you look at them after a procedure that you do, you can see what would have gotten on you had you not been wearing that. So take a good look at it this week and let me know what you think. It contains saliva, blood, and microorganisms and are created with the use of the high-speed handpiece, air water syringe, and ultrasonic scaler during dental procedures. All right, mists are droplet particles larger than those generated in aerosol. Spatter is large droplet particles contaminated with blood, saliva, and other debris, and it happens during a dental procedure when the mucosa or non-intact skin is splashed with blood or blood-contaminated saliva. How do we stop this mode of transmission? How do we stop it? Do these aerosol sprays and spatters have a chance with a dental assistant who knows what they're doing?
Yes.
No, they don't have a chance. Why don't they have a chance? Because we are doing what? We're wearing something.
PPE,
What PPE are we wearing?
masks,
We're wearing masks. What else?
Gloves.
Goggles.
Goggles, shields, okay? To protect our oral and to protect our mucosa, right? So we're using our high volume evacuation, our HVE, our large suction, right? In order to collect as much of that spray and spatter as we can so that it's not making its way up to us, okay? Other modes of transmission, parenteral. What is parenteral transmission? It's a break in the skin. Okay, so if you see this word, parenteral, it is any break in the skin. It can take place through needle stick, bites, cuts, abrasions. We prevent this transmission by wearing proper PPE, by wearing utility gloves when we clean, by making sure that, we announce to our patients like open wide, don't bite down, okay? By wearing gloves. It's very hard to bite through a glove in a hand. Okay, I'm not saying it's impossible, but it makes it a lot harder. All right, bloodborne transmission involves direct or indirect contact with blood and other body fluids. Again, if we wear our PPE, this is not going to be an issue. Food and water transmission occurs when contaminated food that has not been cooked or refrigerated, or water that has been contaminated with human or animal fecal material is consumed. Again, this is not really an issue in dentistry. But it's good to know that that's a mode of transmission. And then fecal oral transmission also should not be a mode of dental or a problem in the dental office, because we are constantly using good hand hygiene. Okay, so as long as you're washing your hands, regardless of what your patients are doing, although I make my patients wash their hands when they come in the room, but regardless of what your patients are doing, you're not going to catch anything from them because you're going to have PPE on and use good hand hygiene. All right. The human body receives resistance to communicable diseases from the immune system. A communicable disease is one that can be transmitted from one person to another by contact with body fluids from another person. Inherited immunity is present at birth. Acquired immunity is developed over a person's lifetime. So let's look at this chart right here. And this chart is in your book. It's the same chart, just in case you want to look at it.
279.
Thank you, 279. Okay, so how I want you to read this chart is this. This is natural, and this column is artificial, okay? This top part here, they should have written this here, is active, and the bottom is passive. Okay, so you see how it would line up: natural, active, artificial, active, natural, passive, artificial, passive, okay? So an active, natural acquired immunity is you actually get the disease. So again, my mom made me stand in the room with my sisters and get chicken pox. Okay, she's like, go sit with your sister and get the chicken pox, because she didn't want to be out of work more than once. Everybody did it. I don't know. That's what we did back then. So you actually contract the disease, and then by contracting that disease, your body produces memory cells. Okay, and those memory cells produce antibodies to help you fight off that disease should you have it again. All right, so that is natural active. You got the disease, your body produced memory cells. Passive natural, you're going to receive maternal antibodies through placenta or breast milk. Again, the reason my son didn't get the flu when I nursed him, okay? I gave him my antibodies. You can pass it through the placenta, you can pass it through breast milk, okay? Pass it on to the child. That is going to be passive natural acquired immunity, okay? He's not really asking for it, but he's receiving it regardless, okay? And that is going to help him or her, whoever, receive the antibodies, thereby being able to fight off the infection should it happen, okay? Artificial active is you actually go and receive a vaccine, and that by receiving that vaccine, again, you get a flu shot, and the flu shot is a live culture, okay, that helps your body produce the memory cells that it needs. So you're kind of, you don't contract the disease, but you're sort of giving yourself a version of it, okay? So once you give yourself a version of that disease, your body produces the memory cells that it needs and to fight off the disease, okay? So if you get a flu shot, it's not a guarantee you're not going to get the flu, but if you do get the flu, it's going to not be as bad as it would have been because your body's already produced memory cells, okay? Passive artificial is you're going to receive anti-serum with antibodies from another host. So for example, a blood transfusion or a white blood cell transfusion. Okay, so it's going to be passive artificial where you actually have to go and sit and receive some sort of anti-serum with antibodies from a separate host. Okay. So you're not going to actually receive the virus at all. So these two, you're actually getting the virus, right? One by just contracting it and one by giving it to yourself. And the other one is passive, one by receiving it through your mother and the other by receiving it through another host. Okay. Does that make sense to everybody?
Yes.
Okay. Okay. Naturally acquired immunity occurs when a person has contracted and is recovering from a disease. And we talked about active and passive immunity. Artificially acquired immunity, antibodies are introduced into the body by means of immunization or vaccination. Okay. Disease transmission in the dental office. Every dental office should have an infection control program designed to prevent the transmission of disease. And these are the way to transmit: patient to dental team to patient, patient to patient, dental office to community, and community to dental office to patient. So let's talk about these. How would the patient, well, first off, which is the one we have to worry about most?
Dental community. Patient to dental team. No?
Patient to dental team, okay? We know we're protected.
Yeah.
We're doing the protecting, okay? So we don't worry about ourselves. The chances we're going to give something to our patient are slim to none. Okay? The chance our patient is going to come in and give something to us, higher probability. All right? How would the patient give something to us? Or how do we stop the patient from giving something to us? We're going to do what? We're going to wear PPE to protect ourselves. We're going to clean and disinfect, right? Okay. To protect ourselves. Dental team to patient. How do we protect our patients? Again, we wear PPE. If we have a mask, even if we're not feeling 1,000%, that mask is going to protect the patient. Okay. It's not only there to protect us, it's there to protect the patient as well. We sterilize, we disinfect, we clean. That is to protect us and our patients. Okay. How about patient to patient? How would a patient pass something on to another patient in the dental field?
Clean everything between patient?
Right. What if you decide you're not going to sterilize instruments and you're just going to rinse them with water? If someone comes in with Hep B, you can certainly pass it to another patient. And if you're not sterilizing your instruments, if you're not disinfecting your rooms, okay? So that's how we stop that patient-to-patient transmission. Dental office to community. What goes out of the dental office that we can prevent? Or what can we do to prevent? So what about if we take an impression and we send it out to a lab? What can we do to that impression?
Disinfected.
Disinfect it, right? What about our clothes? What about our lab jackets?
Leave it in the.
Leave it in the office, okay?
Yeah.
Change your shoes, all right? Or wipe them down, make sure you bring them home in some sort of closed container and change them when you get home, all right? And community to dental office to patient. If somebody's coming in with something and they drop it off in the dental office and then we don't clean or disinfect and bring it from the dental office to the patient, okay?
Yeah.
So we're just going to talk about them in more detail, but patient to dental team, this is the most common route, is through direct contact of the patient's blood or saliva. Droplet infection occurs through mucosal surfaces in the eyes, nose, and mouth. It can occur when the dental team member inhales aerosol generated by the dental handpiece or air water syringe. Indirect contact, which again, what is indirect contact? From the patient to a inanimate object like a surface or an instrument to us, right? Okay, so that's indirect. We don't get it directly from them, but they touch something or something has been touched to them and then we touch that something, all right? Occurs when the team member touches a contaminated surface or instrument. Patient to dental team, ways to prevent disease transmission, gloves, hand washing, mask, rubber dams. What does a rubber dam help?
To keep the area isolated and
It
uninfected.
keeps the area isolated. And so there's only a little tiny area that we're working on, right? And then patient mouth rinses as well.
Mhm.
Dental team to patient, very unlikely to happen. Okay, it can result if a dental team member has lesions on their hands or if their hands are cut while in the patient's mouth, which would never happen because we're always wearing
PPE.
and gloves, right? When we're in the patient's mouth. Permitting the transfer of microorganisms. Infection control measures that help to prevent team to patient include mask, gloves, hand washing, and immunization. All right. Again, highly unlikely. Patient to patient has occurred in the medical field, but no cases have been documented in dentistry. Although such transmission is possible, contamination from instruments used on one patient must be transferred to another patient for this to occur. Infection control measures that can prevent this are instrument sterilization, surface barriers, hand washing, gloves, and use of sterile instruments. Tell me if I'm going too fast. Dental office to community. Microorganisms can leave the dental office and enter the community by contaminated impressions, contaminated equipment sent out for repair. In theory, transportation of microorganisms out of the office on the dental team's clothing or hair. The following measures can prevent this: hand washing, changing clothes before leaving the office, and disinfecting impressions and contaminated equipment. If your handpiece breaks, it should be what before you send it out?
Sterilized.
Sterilized. Okay, don't ever send out a dirty instrument. Community to dental office. Microorganisms enter the dental office through municipal water that supplies the dental unit. Waterborne organisms colonize the inside of the dental unit water lines and form biofilm. We talked about this already. See that crossover again. As water flows through the handpiece, air, water, and ultrasonic, a patient could swallow contaminated water. How do we stop this? Run our handpieces, right? Just run them before the patient comes in. Okay. Okay, this is always all right. A regulatory agency means an agency that sets regulations or laws that have to be followed. Okay. A federal agency is an agency that comes up with guidelines using scientific data that are very good to follow, but they are not laws. Okay. This is really important. And there's definitely questions about this on the test. Oh, why my chair so low? You guys can't see my face, can you? So weird. Okay. Oh, I see. It's not my chair, it's my camera. Sorry about that. I'm like, all I can see is my eyes. CDC is a federal agency, okay? Meaning the CDC sets guidelines and offers recommendations for us to follow. Okay, they're setting recommendations right now for COVID. But if someone walks in your office and you're not doing that, can you get fined? No. Okay. I'm going to stop here for a second and make a judgment call and tell you guys if you can possibly take your ICE exam before the end of the year, it would be to your benefit. Okay, because CDC is passing a lot of recommendations right now, but they haven't yet become laws by OSHA. So once they are laws by OSHA, they are going to be regulated, and infection control is going to change. Okay. So if it was me taking the test, I would like sign up for it, like pronto. Okay. Because they're going to be passing, we know they're going to be passing new laws because of everything that's going on.
Yeah.
Okay. They have not been passed yet. So everything I'm teaching you is 100% correct. Can I say the same for January 31st? I assume they're going to be passing new laws. Okay. Dentistry has always been really, really high on their infection control to begin with. So we didn't have to go that much further, but there's still going to be new regulations. Okay. So word of advice, take it or leave it. I would go and take my ICE exam. Once you have it done, it's done. Not to say you shouldn't learn the new rules because you need to, but you don't have to be tested on them. All right. Okay. Just a word of advice, just throwing that out there. Okay. Federal agencies that play important roles in infection control for dentistry are CDC, which is the Center for Disease Control and Prevention, and the Occupational Safety and Health Administration, or OSHA. Okay. The CDC is not a regulatory agency. It issues specific recommendations based on sound scientific evidence on health-related matters. It establishes a standard of care for the dental profession. It is not a law. Okay. OSHA is a regulatory agency. So anything OSHA says goes. If you are supposed to be disposing of your sharps in a sharps container and OSHA walks in and you're putting all your sharps in a bucket instead of a sharps container, you're going to be fined probably somewhere around $10,000.
Yeah.
Okay. That's a law. All right. That has to be followed. That's a regulation. All right. So please understand the difference. If you don't, I'll explain it again. It's hard to differentiate, I know. But CDC puts forth recommendations, and they're sound recommendations. They should 1000% be followed. I'm following all CDC guidelines, but they're guidelines. Okay. They're not regulations yet. All right. OSHA is a regulatory agency. It issues specific standards to protect the health of employees in the United States. In 1991, based on the CDC guidelines, so OSHA is using the CDC guidelines in order to make the regulations. Okay, OSHA issued the Bloodborne Pathogen Standard, or BBP. As a dental assistant, it is imperative to follow all of OSHA's guidelines and recommendations. Okay. Does everybody understand the difference? I try to make it clear, but if you don't understand, please tell me. I'll explain it again because it is really important to understand. Okay. CDC guidelines for infection control in dental healthcare setting. So in 2003, released by the CDC, guidelines expanded upon the existing OSHA bloodborne pathogen standard and have included some areas that were not already covered. Guidelines are based on scientific evidence and are categorized on the basis of existing scientific data, theoretical rationale, and applicability. Guidelines apply to all paid or unpaid dental health professionals who might be occupationally exposed to blood and body fluids by direct contact or through contact with contaminated environmental surfaces, water, or air. Okay. It's going to be expanded again. I almost can guarantee in 2021, we're going to have a new set of guidelines. Right. So please take your test before that. Not that I don't want you guys to know the new rules. I'm just saying, otherwise you're going to have to possibly have to like retake this course.
Oh God.
I know that I'm telling you for a reason. So, so in 2016, CDC Dental Infection Prevention Summary, they issued the CDC Dental Infection Prevention Summary. It's an easy to understand or read summary of the 2003 guidelines and includes additional topics and information relevant to dental infection prevention and control since 2003, including the following: infection prevention program administrative measures, infection prevention education and training, respiratory hygiene and cough etiquette, like cough into your right? Updated safe infection practices and administrative measures for instrument processing. Okay, and this is the 2016 CDC summary. So there's guidelines for infection control. They have rankings of evidence, category 1A, 1B, 1C, category 2, and unresolved issues. Okay, we'll go through these quickly. I don't think that they're that, I I think they're going to ask more, if they ask you, well, they're definitely going to ask you about OSHA and CDC, but they're going to ask more basic questions than this. I just want to go over this so that you understand, okay? BBP means blood-borne pathogen standards, okay? The most important infection control law in dentistry. It's designed to protect employees against occupational exposure to blood-borne pathogens, such as hepatitis B, hepatitis C, and HIV. All right, so OSHA is setting forth guidelines for us, the workers, all right, to keep us safe. That's their job, is to keep us safe. Employers are required to protect their employees from exposure to blood and other potentially infectious materials, or OPIM, in the office, and to provide proper care to the employee if an exposure should occur. Okay, so it's your employer's job to do this. The BBP applies to any type of facility in which employees might be exposed to blood and or other body fluids, which include dental and medical offices, hospitals, funeral homes, emergency medical services, and nursing homes. OSHA requires that a copy of the BBP be present in every dental office and clinic. Okay, so somewhere in your office, there should be a copy of this BBP. And there should also be exposure booklet on what to do if an exposure occurs. Okay, or exposure control plan, it's called. And this exposure control plan clearly describes how the office complies with the standard, and universal precautions is referred to in the OSHA bloodborne pathogen standards. What are universal precautions? We use them every day in our jobs. Universal precautions means every person that walks in our office
It has to be treated the same, right?
has to be treated as if they have a communicable disease.
Yes, in fact.
Okay? Meaning, if someone walks in and they fill out their health history and they're not on any medications and they've never been sick and they have no susceptibility, we're still wearing gloves. We're still putting up barriers. We're still cleaning and disinfecting. We're still autoclaving instruments. Okay? Because we know exactly what people tell us. Is every person in the world honest?
No.
No. Oh my God. People don't say things sometimes, or
Yeah.
people may not know. If someone's walking around with a latent illness, they may not even know they have it.
Yeah.
So every person that walks in that office, we treat the same. We treat as if they have it. We treat them as if they have HPV. We treat them as if they have HIV, okay? Every person that walks in that office, that is universal precautions, okay? So universal precautions are based on the concept that all human blood and body fluids, including saliva, are to be treated as if known to be infected with one of the bloodborne diseases, HBV, HCV, or HIV. The CDC expanded the concept and changed the term to standard precautions. Okay, so it's no longer called universal, it's now called standard precautions. Standard precautions takes that universal and integrates and expands the elements into standard of care designed to protect healthcare providers from pathogens spread by blood or any other body fluid, excretion, or secretion. Okay, so this one is bloodborne. This one is any body fluid. Okay, so we are now using standard precautions, meaning we're not just saying everybody that walks in the door has HIV. We're also saying everybody that walks in the door, I mean, in this day and age, has COVID, right? And we're protecting ourselves and our other patients accordingly. We're using high volume evacuations. We are wearing proper PPE. We are barriering. We are looking at our sporicidals and making sure that we're not just wiping once, that we're wiping, drying, wiping, and letting it dry on its own. Okay, we're using standard precautions that include body fluids other than blood. It is not possible to identify those individuals who are infectious, so infection precautions are used for all healthcare personnel and their patients. Okay. So there's different categories of employees. within the offices. The OSHA BBP standard requires employers to categorize tasks and procedures during which an employee might experience occupational exposure. What is occupational exposure? Just look at the words and you should know. Well, it's on here too, so you can cheat. Any reasonably anticipated skin, eye, mucous membrane contact, or percutaneous. Again, what was percutaneous?
Under the skin.
Needle stick, right? Injury with blood or any other potentially infectious material. Occupational exposure is exposure due to your occupation, right? So anything that can happen due to your occupation, so any reasonably anticipated skin, eye, mucous membrane contact, or percutaneous injury with blood or any other potentially infectious materials. So there's 3 categories, okay, of occupational exposure. Category 1 employees are what? You can cheat. We are category 1 employees, right? Is everybody here an assistant or some people work at the front?
I work in the front.
You work in the
I'm an
front.
assistant.
You're an assistant. Okay, so for the people that work at the front, do you ever run into the back and help?
Well, I used to be an assistant, so yes.
Okay, so no. So I want you to look at what we're doing next. So a category 1 is routinely exposed to blood, saliva, or both. That's going to be dentist, dental hygienist, assistant, sterilization tech, lab tech, okay? That's a category 1. A category 2 may on occasion be exposed to blood, saliva, or both. That's going to be your front desk person that runs in the back to help you clean a room. Now, we all know that there's front desk people that will not do that. We know that there's people that only do the financing, or people that do insurance checking, or people that do treatment planning, and they never come and help. And that's okay. That's not their job. They are category 3. They are never exposed to these things. Okay. So those are the 3 categories. We have 1 who's always exposed. We have 2 that on occasion may be exposed. And then we have 3 who is never exposed. Okay. Those are the only 3 categories. All right. Post-exposure management. Accidents happen. Before an accident occurs, the BBP requires the employer to have a written plan. This plan explains exactly what steps the employees must follow after the exposure incident occurs and the type of medical follow-up that will be provided for the employee at no charge. If you get stuck with an instrument, there should be something in your office. You should go to your office manager or your dentist or whoever is your boss. Let them know, hey, I got stuck by an instrument. There should be a protocol that's followed. Okay. 100% in every office. All right. It should be something to the effect of, you need to go get tested. They need to call the patient. The patient needs to go get tested. And then you need to do a 3 or 6 month follow-up is usually the case. All right. Oh, here. The following services must be offered without charge: confidential medical counseling, HIV tests immediately at 6 weeks, 12 weeks, and 6 months. Okay. If you opt out of this, you should sign something. I wouldn't opt out of it. It's not, should never be out of your pocket. Okay. It's regulated by OSHA. All right. So if something happens to you in your office, you should tell someone, you should go get tested. You should have your patient get tested. Okay. It's not worth not knowing. The BBP standard requires the dentist to provide training in infection control procedures and safety issues to all personnel who may come in contact with blood, saliva, or contaminated instruments. So what 2 levels would have to be part of this employee training out of the 3 levels?
First 2,
The first 2. Why doesn't the 3rd one?
because they're not exposed.
They're not exposed. Okay. They don't need training. They're not exposed. They're not coming into the back, and they're not going to be in contact. All right. Employer must keep records, and the record must include the date, the name, the topic, and all the employees who attended. We talked about this earlier too, the Hep B immunization. OSHA requires the dentist to offer this to all employees whose jobs include category 1 and 2 tasks. Okay, vaccine must be offered within 10 days of employment. They must obtain proof from the physician, and the employees have the right to refuse. However, they must sign an informed refusal, and that must be kept in the office on file, because if you are exposed and you've signed this, you're up the creek. Okay. The vaccine is administered in a series of 3 injections, usually 0, 1, and 6 months. The preferred injection site is the arm. Post-vaccine testing between 1 and 2 months after the series has been completed, a blood test should be performed to ensure that the individual has developed immunity. A physician should evaluate individuals who have not developed immunity to determine the need for an additional dose. Individuals who do not respond to the second 3-dose series should be counseled regarding their susceptibility to HBV infection and the precautions that they must take. There are some people who don't respond to the vaccine. Very few people, but some people. So if you are one of those people, you may rethink your career in dentistry. Routine booster doses are not recommended by the CDC, okay? The CDC does not recommend routine blood testing to monitor the HBV antibody levels on individuals who have already had the vaccine. The exception is if they have a documented exposure incident and their attending physician orders the administration of a booster dose, okay? They can check you for titers, which I had to do. One job I worked in the operating room, and I had to be tested for all the different hospitals that I worked in. So they checked my titers to make sure I had it. Another thing, if you teach in a school setting, the school I teach at is adult ed and high school. So I don't know if that's the difference between it, but I again had to go and make sure I had my titers for Hep B. Okay. So those are reasons that they might check, but I didn't need a booster dose. The dentist employer must keep a confidential medical record for each employee. These records are confidential. They must be stored in a locked file for 30 years. Contaminated needles and other disposable sharps must be placed into a sharps container. Okay. Again, this is OSHA regulated. The sharps container must be puncture resistant, closable, leak proof, and color coded or labeled with a biohazard symbol. You guys should know it as something that looks something like this. It might be a little different, but it should look something like this, okay? You should be able to put things in and have a very difficult time getting them out. It should be puncture resistant. It should be closed. It should be leak proof, and it should be color coded, okay? They must be located as close as possible to the place of immediate disposal. Hopefully you guys have the one in every room, but if not, at least very close. Do not cut, bend, or break needles before disposal. I don't care how anybody told you to do it. That's not how you're supposed to do it. Never attempt to remove a needle from a disposable syringe. Again, I understand what happens in offices, and what I'm telling you is these are the rules, okay? So whatever you do in your office, you do in your office, but you need to remember these rules in order to pass your boards. So do not attempt to remove a needle from a disposable syringe. Do not cut, bend, or break the needles before disposal. I've worked in many offices. I see how many things go on. I know, again, things that happen in offices aren't always the way they're supposed to be. You do you, but this is the way it should be done, okay? Never recap used needles by using both hands. What should we be using?
There's a technique, the scoop technique, no?
Single-handed scoop
Oh, really?
technique.
Yeah, really.
Or they have needle holders, some type of safety device. It almost looks like an amalgam carrier, but it's higher and you can sit the needle right in it. Okay, but single-handed scoop technique. All right. Don't use both hands. Don't go like this. Your eyes are not that good. Okay, they're not. Hand washing guidelines. I know it sounds silly that we need to go over this, but I teach my dental assisting class how to wash their hands. Some of them don't know. Not gonna lie. Okay. Wash your hands each time before you put on gloves and after you remove gloves. Okay, again, I work in an office. I know how things go. I know you're busy. This is how it's supposed to be done. Every single time you're going to put on a pair of gloves, you should wash your hands. Every single time you take off a pair of gloves, you should wash your hands. Okay? Wash your hands when you inadvertently touch contaminated objects or surfaces while barehanded. Always use liquid soap during hand washing. Hopefully none of you have bar soap. Bar soap makes me want to throw up anyway. Bar soap should reminds me when I was a kid, I had to clean my dad's bathroom.
Oh.
Okay, bar soap should never be used because it may transmit contamination. Okay, obviously, like more than one person is touching it.
Yeah.
All right, so ixnay on the bar soap. Always use liquid soap. Okay, so you're washing before you put on gloves, after you take off gloves, and anytime you touch any contaminated surface with your bare hands. All right. For most routine dental procedures, such as exams and non-surgical, an antimicrobial soap can be used. For surgical procedures, you should use a germicidal surgical scrub product. Dry hands well before donning gloves. Do any of you work in the, no, nobody works in the OR, right? That is the only time I ever had to use this germicidal surgical scrub. Okay. And at that time, I wasn't just using regular gloves. I was using sterile gloves, which come in a closed packet. One pair of gloves. Okay. So, you know, if you're working in this environment where you need to do a surgical scrub, which is up to here. Other than that, for most routine, an antimicrobial soap is fine. Commonly missed areas during hand washing. Okay. Most frequently missed. When people wash their hands, I watch them because I have everybody wash their hands when they come in. Rarely do I see them go like this, which means that they are missing in between their fingers. Rarely do I see them wash their thumbs, so they're missing their entire thumb, okay? And their fingernails, all right? So they're missing under their fingernails, all right? So be a good hand washer. Keep nails short and well manicured. Rings, except for wedding rings, fingernail polish, and artificial nails are not to be worn at work. This is a guideline, okay? Dental personnel with open sores or weeping dermatitis must avoid activities involving direct patient contact and handling contaminated instruments or equipment until the condition on the hands is healed. All right? Any questions about that? Okay. Why don't we wear big diamond rings when we work?
It can puncture the glove.
It can puncture the gloves, okay? Why don't we want to wear fingernail polish or acrylic nails? They can break and they can chip into the patient's mouth, okay? Alcohol-based hand rubs, otherwise known as antibacterial. These are waterless antiseptic agents. They are alcohol-based products available in gel, foam, or rinses. The product is applied to the hands, which are then rubbed together to cover all surfaces, exactly like you would do hand washing. Okay, because again, the same surfaces are getting missed with alcohol-based hand rubs. These products are more effective at reducing microbial flora than plain soap. Concentration of 60 to 95% are the most effective. They contain emollients that reduce incidence of chapping, irritation, and drying of the skin. And these products are very dose sensitive. You don't need a lot. You don't need 6 pumps in your hands, okay? Contrary to popular belief. You have to be careful, especially now, because I think a bunch of them got recalled. And the ones that got recalled did not contain emollients. So what they were doing is drying out the skin. And then when the skin is dried out, you get these micro cuts, which makes you more susceptible to catching stuff. Okay, so be careful with these. For most routine dental procedures, such as exams and non-surgical, wash your hands with either a non-antimicrobial or antimicrobial soap and water. If your hands are not visibly soiled, you may use waterless alcohol-based hand rub, okay? If your hands are visibly soiled, soap and water. All right. This waterless alcohol-based hand rub does not remove debris. Okay. For surgical procedures, you should perform a surgical scrub using non-antimicrobial or antimicrobial soap and water. Dry your hands and apply an alcohol-based surgical hand rub. Okay. And unless you guys work in the OR, it's not really going to be a thing. Okay. This is what water-based hand product looks like. Okay. It's important for us to use lotions because our hands get so dried out. We wash them so much. We use so much antibacterial hand gel that our skin does tend to get dried out. So it is important to moisturize. All right. PPE, my favorite source of infection control. All right. OSHA requires the employer to provide employees with the appropriate PPE without charge to the employee. Examples of PPE include protective clothing, surgical masks, face shields, protective eyewear, disposable patient treatment gloves, and heavy-duty utility gloves. Protective clothing protects the skin and underclothing from exposure to saliva, blood, aerosol, and other contaminated materials. Types of protective clothing include smocks, slacks, skirts, lab coats, surgical scrubs, scrub hats, pants, and shoe covers. Okay. Probably in your office, you are wearing lab coats of some kind, I would guess at this point. They should be at least below the knee. All right.
Really?
Yeah. Yep. Mhm. The type of protective clothing you should wear is based on the degree of anticipated exposure to infectious materials. Now, if you work at the front desk, that's not the case, but working in the back, it is, because you want your scrubs covered, right? Yeah. Okay. You want as least exposure as possible, especially to bring out of that dental office and home to your families. Okay. So wearing a long jacket will prevent anything from getting on what you're wearing in. Changing your clothes is a double prevention as well. All right. The BBP prohibits the employee from taking protective clothing home to be laundered. So if you're wearing a lab jacket that your work provides for you, that should be left at work. You should either have a service or it should be disposable. Okay. Protective clothing should be made of fluid resistant material. So the cute little lab scrub coats that you buy do not count as protective clothing. All right. They're cute. They keep us warm. They don't count. All right. Protective clothing is used as a means of minimizing the amount of uncovered skin. Clothing should have long sleeves and a high neckline. If you leave it open, like my shirt, it doesn't help you. The design of the sleeve should allow the cuff to be tucked inside the band of the glove. That's why the sleeves are cuffed. Okay. They need to go inside the glove. During high-risk procedures, protective clothing must cover dental personnel at least to the knees when seated. So nowadays, any type of procedure where you're using a dental drill, really. Okay. Buttons, trim, zippers, and other ornamentation should be kept to a minimum. And this is what it should look like. This person, probably works at the front desk, does insurance. They are a category what?
Three.
3, okay. This looks like possibly the doctor. All right, they have their high neckline, they have their gloves, mask, goggles, they have a lab jacket that covers at least to their knees. Same thing with this person, okay? They have a lab jacket that covers at least to their knees. This is what my jacket looks like, but possibly because I'm really short. Again, their sleeves are tucked into their gloves. Their neckline is high. They're wearing a mask. They're wearing goggles, okay? In my office, we also wear a head covering and a shield.
Yeah, that we do, yes.
Okay. The BBP standard protective clothing may not be taken home and washed by employees. It may be laundered in the office if the equipment is available. And if standard precautions are followed for handling and laundering the contaminated clothing, Contaminated linens that are removed from an office for laundering should be placed in a leak-proof bag with a biohazard label or an appropriately color-coded label. Disposable gowns must be discarded daily and more often if visibly soiled. Protective masks are worn, I wish I could put this on the TV somewhere, over the nose and mouth to protect you from inhaling possible infectious organisms spread by the aerosol spray of the handpiece or air water syringe and accidental splashes. If you're only covering your mouth and not your nose, does that help? Okay. Both need to be covered. A mask with at least 95% filtration efficiency for particles 3 to 5 millimeters in diameter should be worn whenever splash or spatter is likely. The two most commonly used type of masks are dome and flat. Okay. And you guys have seen them all. Usually the N95 are kind of dome shaped and the level 3 are flat. All right. I don't know about you guys. I wear 2 masks all day. I wear an N95 with a level 3 on top. Masks should be changed for every patient or more often set by the CDC guidelines. All right, to handle a mask, touch only the side of the mask. Okay, avoid contact with the heavily contaminated body of the mask. The mask should conform well to the face. And I will tell you in 2021, they're going to have something about fitting an N95 mask. I know they are, all right, because they're teaching classes on it now. So again, it will change. The mask should not make contact with the mouth while being worn because the moisture that is generated will decrease filtration efficiency. A damp or wet mask is not an effective mask. Okay. I'm going to repeat that. A damp or wet mask is not an effective mask, right? If the mask is touching your mouth and the mask is getting wet, it is not effective. A wet mask, things can get through. Okay, protective eyewear is worn to protect eyes against the danger of damage caused by aerosolized pathogens. It also prevents spattered solutions or caustic chemicals from injuring your eyes. OSHA requires the use of eyewear with both front and side protection. Okay, so would a pair of regular glasses work as protective eyewear?
No.
No, they do actually sell little plastic things that go on the side. So if you wear them on your regular glasses, you could use them. The problem with that is you're leaving the office with these. Okay, so it's not a good idea. All right. If you wear contact lenses, you must wear protective eyewear with side shields or a face shield. After each treatment or patient visit, clean and decontaminate protective eyewear in accordance with manufacturer's instructions according to the CDC guidelines. All right. Face shield is a chin-length plastic face shield, may be worn as an alternative to protective eyewear. Can you wear a face shield as an alternative to a mask?
What is it again?
No. Okay, you can wear it instead of eye, but there's an opening.
Yeah, you have to wear your mask. Yeah.
Okay, you have to wear your mask. I know I have a girlfriend that's like, well, I wear a shield. And I was like, you can still breathe in.
That's like people wearing masks and not covering their nose.
That's what I'm talking like. I call them the chin strappers. Actually, I had a patient that came in, her mask was gorgeous. I was like, wow, your mask is really beautiful. It was mesh, like a mesh with dragons and stuff on it. She says, I just wear it for compliance. And I was like, it's actually not compliant at all. It's pretty. If you maybe wear another mask under it.
Yeah.
But so that's why we wear our own masks too, okay? Because we're protecting ourselves and other people. All right. So someone who's not wearing it is not helping to protect other people, which, you know, stinks, right? Because, you know, it's not just for your benefit, it's for other people's benefits as well. When splashing or splattering of blood or other body fluids is likely a procedure, a face shield is often worn in addition to a protective mask. Okay. And it might look something like this.
Mm-hmm.
Okay, and this part right here better have a piece of plastic in it if that's open. It usually has one that sticks up, but right. Patients should be provided with protective eyewear because they also may be subject to eye damage during the procedure.
Yes.
This may result from handpiece spatter, spilled dental materials, including caustic chemical agents, airborne bits of acrylic, or tooth fragments. Okay, so your patient should be wearing eyewear as well. All right. If you don't have eyewear in your office, then I suggest whoever's calling the patients, ask them to bring their own sunglasses in. All right. Because dental personnel are most likely to come into contact with blood or contaminated items with their hands, gloves may be the most critical PPE. You must wear a new pair of gloves for each patient, remove them promptly after use, and wash your hands immediately to avoid the transfer of microorganisms to other patients or the environment. Consult with the glove manufacturer regarding chemical compatibility of the glove material and the dental materials you use. Okay, this is what it should look like. Gloves are non-sterile, okay? You will have an easier time washing your hands than you will if you wear gloves around all the time.
I don't want to wear this thermal.
All gloves used in patient care must be discarded after a single use. These gloves may not be washed, disinfected, or sterilized. However, they may be rinsed with water to remove excess powder. Latex, vinyl, or other disposable medical quality gloves may be used for patient exam and dental procedures. Torn or damaged gloves must be replaced immediately. Do not wear jewelry under gloves. We talked about that already. Change gloves frequently. Remove contaminated gloves before leaving the chair side during patient care and replace them with new gloves before returning to the patient care. Hands must be washed after and before glove removal and regloving. Gloves are effective only when they are intact, not damaged, torn, ripped, or punctured. If gloves are damaged during treatment, they must be changed immediately. The procedure for regloving is excuse yourself and leave the chair side, remove and discard damaged gloves, wash hands thoroughly, and reglove before returning to the dental procedure. Any questions on that?
No.
I know this doesn't always happen in offices, but this is the way it's supposed to be. Are you guys okay if we finish this up and then we'll take a break for lunch? Do you want a full half hour or just 15?
Half hour.
Okay. I know I talk a lot. So we'll take a full half hour. I gotta walk my dog anyway. We'll take a full half hour for lunch. Let me just, if that's okay with you guys, if I just finish this and then we'll take the quiz after. Is
Yes.
that okay? Okay, perfect. Okay, sorry, I got lost. The chemicals you come in contact with on a daily basis may damage your gloves. Because so many dental materials are available on the market, you should consult the glove manufacturer about the compatibility of material with various chemicals. There is a dental material, it's a putty, it's orange and white, that breaks down latex. So do really read your manufacturer's instructions, because it used to be if you used putty 20 years ago when I started dental assisting, you had to do it with your bare hands. Now, of course, you can use non-latex gloves. Examination gloves are usually made of latex or vinyl, referred to as exam gloves or procedure gloves. They are worn by dental professionals. Available in sizes, this isn't correct, extra small to extra large. Over gloves are known as food handler gloves. Does everybody know what they look like? They're like little clear plastic gloves. Okay, not every office has them, but you still need to know what they are. They are, let me see if I can find a page. On page 293. Okay, at the top right. I'm sorry, I don't have a picture of it here. But they are clear gloves. They're also called food handler gloves. So you might see people wearing them like in the deli. They're made of lightweight, inexpensive, clear plastic. They may be worn over contaminated gloves to prevent contamination of clean objects. So if you need to grab a cotton roll from the drawer, you can use your cotton pliers, or you can put on an overglove, open the drawer, get out what you need, put it out, and then throw that overglove away. All right, so it's like can go over your contaminated gloves in order to retrieve clean items. Over gloves are not acceptable alone as a hand barrier or for intraoral procedures. They must be worn carefully to avoid contamination during handling with contaminated procedure gloves. They are donned before the secondary procedure is performed and removed before patient treatment. Over gloves are discarded after a single use. Sterile surgical gloves, like I said, worn for invasive procedures involving bone cutting. Even our oral surgery department doesn't use these. The only time I ever used sterile surgical gloves was in the OR. Okay, because they're single prepackaged units to maintain their sterility, and they're provided in sizes and are fitted to your right or left hand. Everyone should know what utility gloves are. Everybody should have utility gloves in their office. You may not be using them properly, but what you learn here is how you should be using them and what you need to know for your boards, okay? Utility gloves are not used for direct patient care. They must be worn when the treatment room is being cleaned and disinfected between patients, okay? While contaminated instruments are being cleaned and handled. Why is it important to use utility gloves to clean instruments?
Didn't hurt yourself.
They're thicker, right? So
Yeah.
there's a less of a chance of you puncturing yourself. For surface cleaning and disinfection, utility gloves may be washed, disinfected, sterilized, and reused. Okay. Used utility gloves must be considered contaminated and handled appropriately until they have been properly disinfected or sterilized. This is what utility gloves look like. Hopefully you have a pair or two in your office. Non-latex containing gloves, healthcare providers or patients may experience serious allergic reactions to latex. For the person who is sensitive, there are gloves made from vinyl, nitrile, and other non-latex containing materials. During a dental procedure, it may be necessary to touch surfaces or objects such as drawer handles and material containers. If you touch these objects with a gloved hand, both the surface and the glove become contaminated. To minimize the possibility of cross-contamination, use an overglove when necessary to touch a surface. Okay, or again, you can use your cotton pliers to open a drawer, take out a cotton roll. All right, just make sure you're not just using your contaminated gloved hand. Opening drawers and cabinets, set up instruments, medications, and impression material ahead of time, and use disposable and unit dose items whenever possible. When opening a container, use overgloves, a paper towel, or a sterile gauze sponge to remove the lid or cap. Use sterile cotton pliers to remove an item from the container. Okay. I always have an extra pair of sterile cotton pliers near me in case I need to do something during a procedure. Right. For high-tech equipment, every aspect of dentistry is entering the arena of high-tech equipment and devices. You must carefully consider what infection control procedures are needed to make each piece of equipment safe to use. Always follow manufacturer's infection control recommendations for every device and piece of equipment. Are you going to clean your computer keyboards with Envirocide?
What is it again?
Are you gonna clean your computer keyboards, or are you gonna clean your digital sensors with Envirocide? Not if you want them to last. Okay. So what are you going to use on those high-tech equipment instead?
Plastic shields over?
Barriers, right? Okay. If something has a barrier on it, underneath is considered clean.
Yeah.
Okay. So it doesn't need to be wiped after. The use of natural rubber latex gloves has proved to be one of the most effective means of protecting the dental worker and patient from the transmission of disease. The number of healthcare workers and patients who have become hypersensitive has increased dramatically. The CDC guidelines include recommendations for contact dermatitis and latex hypersensitivity. So there's 3 common types of allergic reaction to latex. All right, there's irritant dermatitis, there's a type 4 allergic reaction and a type 1 allergic reaction. 2 of these involve an immune and 1 involves only a surface irritation. Which one do you think involves only a surface irritation?
Irritant.
Irritant or contact dermatitis. Okay. Irritant dermatitis is a non-immunologic process, so it does not involve the body's immune system. It's caused by contact with the substance that produces chemical irritation of the skin. The skin becomes red, dry, irritated, and cracked, and it can be reversed by identifying and correcting the cause of the problem. So get rid of the latex. Your problem is gone, okay?
Mm.
It looks something like this. This is what most healthcare workers have. If they become allergic to latex or hypersensitive to latex, this is usually what their hands look like. And if you just get rid of the latex, wash your hands, this should go away, right? Type 4 allergic reaction is the most common type of latex allergy. It is a delayed contact reaction and involves the immune system. So it may take as long as 48 to 72 hours for the red ishy rash to appear. Reactions are limited to the areas of contact and do not involve the entire body. An immune response is produced by the chemicals that are used to produce the latex used in manufacturing gloves, not by the proteins in latex. Okay, so if you have a type 4 allergic reaction, your patient will probably come in the next time and say, hey, I had this weird reaction last time I left here, like a day or two later, I was red and itchy around my mouth. That's a type 4 allergic reaction, okay? That's a patient that's allergic to latex. It's not an acute allergy, right? It's not very severe and happening right away, but it is an allergic reaction. So those patients you don't want to wear latex for. A type 1 allergic reaction is the most dangerous type of latex allergy. It can result in death. Okay, so when you hear about an allergy like this is when you're talking about your EpiPen, all right? The reaction comes in response to the latex protein in the glove, not to the chemical additives, so the actual protein in the latex, and it's a severe immunologic response 2 to 3 minutes after the latex makes contact with the skin or mucous membrane. At this point, if the patient's under IV sedation, you would immediately give them Benadryl. If not, you might have to give them an EpiPen or Benadryl pills, depending on how severe the allergic reaction is. Okay, so this occurs immediately. This is an acute reaction. It occurs very severely and immediately. This patient should not have latex anywhere near them. Okay, there is no specific cure for latex allergy. The only options are prevention, avoidance, and treating the symptoms. Anyone who suspects an allergy to latex should see a qualified healthcare provider to have a test. Once it has been diagnosed, the affected person should practice latex avoidance in all aspects of their life. Remember, when a latex allergy has been diagnosed in one employee in the dental office, all staff members should use practices to minimize the use of latex containing products. These practices include wearing of powder-free gloves. I don't even think they make latex gloves with powder in them anymore, do they? I think they're all powder-free. By all dental staff members to minimize the risk of airborne latex particles. Dental practices are subject to a wide variety of federal, state, and local regulations concerning waste management. So let's talk about this for a second, because I know this is some sort of question on the test. If you have a federal practice, a state practice, and a local practice or local regulation, so federal regulation, state regulation, and local regulation, which is the most specific?
I'm here. What?
So federal
Which is the most what?
federal regulation is like the umbrella of regulations, okay? The states don't always set aside a different regulation, but if they do, it has to be as strict as federal, at least as strict as the federal, possibly more, okay? Local has to be at least as strict as the state, possibly more. So the strictest would be the most local, okay? If that's a question, it would, the strictest would be the local, all right? The Environmental Protection Agency, or EPA, and most state and local regulations do not categorize saliva or saliva-soaked items as infectious waste. Okay, so if an item is soaked with saliva, it is not considered infectious waste. All right, and there's a whole chapter on this, so we'll definitely get to this too. Because of the high probability that blood may be carried in saliva during dental procedures, CDC guidelines and OSHA regulations consider saliva in dentistry a potentially infectious body fluid. All right, so we consider it infectious, but the EPA does not see it as infectious. So there's different classifications of waste. We have general waste, which is all non-hazardous, non-regulated waste. It should be discarded in covered containers. So a regular trash can with a cover on it is fine. Examples include disposable paper towels, mixing pads, and empty food containers. This is just general waste, okay? Contaminated waste is waste that has had any contact with blood or other body fluids. Examples include used barriers and patient napkins, where they're not soaked with it, but they've come in contact with it. Okay, that's contaminated waste. So we have general, it's just regular trash. Then we have contaminated waste, all right? Finally, we have hazardous waste. This poses a risk to human beings and the environment. Toxic chemicals and materials are hazardous waste. Examples include scrap amalgam, fixer solution, and lead foil from X-ray film packets. All right. Infectious or regulated waste is biohazard. You should have something in your office in a giant red bag with a big biohazard symbol, or a big cardboard box with a red bag in it. Hopefully everybody has that. Contaminated waste that is capable of transmitting an infectious disease. Some items, such as extracted teeth with amalgam restorations, may be both hazardous because of the amalgam and infectious because of the blood. Most dental offices are exposed to the following types of infectious waste: blood and blood-soaked material, pathologic waste, and sharps. Dispose of extracted teeth as regulated medical waste unless being returned to the patient. I never return the teeth to the patient unless it's a baby tooth, but when teeth are returned to the patient, the provisions of the standard no longer apply. Do not dispose of extracted teeth containing amalgam in regulated medical waste that will be incinerated. Okay, so if it has amalgam in it, it has to be disposed of in the hazardous. All right. Because of the mercury in amalgam fillings, you should check with state and local authorities for regulations regarding disposal of teeth containing amalgam. Contaminated items that may contain body fluids, such as gloves and patient napkins, should be placed in a lined trash receptacle. A receptacle for contaminated waste should be covered with a properly fitted lid opened by a foot pedal. Okay, this is for contaminated waste. Contaminated waste, again, is waste that has contact with blood or other body fluids. All right. Keep the lid closed to prevent air movement and the spreading of contaminants. Red bags or containers should not be used for unregulated waste. Check the specific requirements of your local, state, or county health department. Medical waste is any solid waste generated in the diagnosis, treatment, or immunization of human beings or animals in research. Infectious waste is a subset of medical waste. Containers of infectious waste or regulated waste must be labeled with the universal biohazard symbol identified in compliance with local regulations, and containers used for holding contaminated items must be labeled. So you should have something that looks similar to this in your office for your medical or infectious waste, okay? A big red bag, something like that, all right? Once contaminated waste leaves the office, it's regulated by the EPA by state and local laws. Under most regulations, the manner of disposal is determined by the weight of infectious materials requiring disposal. The average dental practice is categorized as a small producer of infectious waste, and disposal is regulated accordingly. The law requires the dentist to maintain records of the final disposal, including documentation of how, when, and where it was disposed. Okay. Unless you're in charge of that, I wouldn't worry about it. But they do need to keep records of that. OSHA bloodborne pathogen standard we talked about, that's the BBP. Never eat, drink, smoke, apply cosmetics, or handle contact lenses. Okay. Can you give me like 5 minutes or no? If you can, it's okay. In any area of the dental office where contamination is possible, such as treatment rooms, laboratories, sterilization, or x-ray processing areas. Okay, never store food or drink in a refrigerator that has contaminated items. And you can minimize the amount of splash and spatter during dental procedures with your dental dam and high volume evacuation, right? And that's your large section. CDC guidelines. This is important because I'm sure we have all done this once or twice. Do not advise patients to close their lips tightly around the tip of the saliva ejector to evacuate oral fluids.
And
Many
why is
patients,
that? I'm sorry.
huh?
I always tell them to do that. Oh God.
Yeah, I know. Many patients have become accustomed to closing their lips around the suction. It creates a back suction, which can be potentially harmful.
Oh.
All right. Use PPE when handling items in the laboratory until they've been decontaminated. Clean, disinfect, and rinse all dental prosthesis and prosthodontic materials, such as impressions, occlusal rims, extracted teeth. Consult with the manufacturers regarding the stability of specific materials, such as impression materials relative to disinfection procedures. Okay, you don't want to over wet anything, especially. Oh, I just had a brain fart. What's the most common impression material? I'm losing my mind.
Alginate?
Thank you, alginate, because it can be imbibed with water. Okay, so just a quick spray. Clean, heat sterilize items used in the mouth that can be. Follow manufacturer's instructions for cleaning, sterilizing, or disinfecting items. Pre-procedural mouth rinses are intended to reduce the number of microorganisms. It can decrease the number introduced into the patient's bloodstream during dental procedures. There is scientific evidence that pre-procedural mouth rinse prevents clinical infection among health professionals. And this is one of those unresolved issues, and no recommendation has yet been made. But again, in 2021, I believe that will change. Okay. So right now, there's no regulation about it, but that may change. Tuberculosis, we talked about. It recommends that elective dental treatment be delayed until the patient is not infected. For patients who require urgent dental care, there are places or facilities that have TB engineering controls. It is not your office. Okay, if someone has active TB infection, they should not be in your office. There are places they can go. Creutzfeldt-Jakob disease and other prion. These are neurologic disorders. They have incubation periods of years, but once you contract them, they're usually fatal within 1 year of diagnosis. Again, this is an unresolved issue. No recommendation is offered regarding the use of precautions for that. Laser electrosurgery or surgical smoke involves use of smoke byproducts. Again, this is an unresolved issue, so they don't know what to do about it yet. All right, and this is cauterizing, if any of you work in oral surgery. Any questions? All right, we're going to take a break. It's 12:20. I will see you guys back here in 30 minutes, so 12:50, and then we'll do our little quiz. Okay? Okay. Enjoy your lunch. Hi guys, everyone back. I hope you enjoyed your lunch.
Yes.
I know my dog enjoyed being walked. Okay, 19 is a humongous chapter. All right. So let's go through the quiz and see how we do. All right. I think there's 25 questions in this one. Just call out the answer, whichever one I hear first. I'm not going to tell you whether it's right or wrong. We'll kind of find out at the end, and I'll help you look up. We'll look up any answers that we get wrong in the book, so that you can know where to find them. And again, at the end of today, I am going to. Everybody will get an invite from me for a Google Classroom. So if you get an invite from a weird name, it's me. I think it's N Lessiger is my email address. So accept, and then in that Google Classroom, I can't put these practice quizzes in there. It won't let me because you guys didn't. I had to buy this book online, but I'm going to put all the PowerPoints in, and the Zoom meeting will go in, and I'm going to open up some practice tests for you guys to take. So if you want to take them, and then if you have any questions on them, we can go over them next week. That's perfectly fine. You're not required to take them, but I think it's a good idea. So up to you. Okay. When contaminated instruments or surface transfer pathogens, it is direct or indirect transmission.
Correct.
Direct.
Okay, so let's talk about this again. What is direct transmission?
Person to person.
So let me read this question again. When contaminated instruments or surfaces
So it would
transfer
be
pathogens.
indirect.
Does everybody understand why that is? I wanted to tell you the answer to that one because it's really important that you understand the direct and indirect. Direct contact is person to person. You are directly contacting from the person. Indirect is going to be the person to an inanimate object to you. That's indirect. Okay. The herpes virus is transmitted through as in
Dog, all the above.
well, the one thing to understand here is it doesn't tell us which herpes virus, right? So they could be talking about any of them.
Yeah.
All right. The ability of a pathogen to overcome the body's defenses and cause disease is known as
Virulence.
C.
transmission through the eyes or mouth is known as
Permucosal.
Why did you choose permucosal? Just out of curiosity.
Just because of the mucus part of it.
Okay, so look at the words that are there. See if you can find any word inside the word you don't know that you do know, and chances are you know at least somewhat what that word means. All right, it's a really good way to take a test. Which of the following is not a type of infection?
Genetic.
Genetic.
Examples of a portal of entry for pathogens include
All of the above.
Did I hear all of the above?
Yes.
Okay. Which of these diseases is spread through direct transmission?
All of the above.
Immunity acquired through vaccinations is referred to as. So let's break this up, okay? First of all, do you remember what naturally acquired? Do you remember what the naturally acquired immunity was? How would you get something naturally? Remember that big box? Remember there was natural and then artificial and then active and then passive, right?
Hmm.
Something that's given to you and something that you gain from your.
So if it's naturally acquired, you're either contracting, right?
Hmm.
Or
It would be artificially.
so either you're getting the disease or it's being passed through membrane or breast milk. Okay, so that's naturally. What about artificially? Artificially, we get through what?
Vaccines.
Or transfusions. Okay.
Mhm.
The transfusion, was that active or passive?
It's
Passive.
So let's read this again. Immunity acquired through vaccinations is referred to as.
C.
Okay. So again, you guys know this, but you have to take a step back sometimes and kind of put it all out on the table so you can look at all of it at once. Okay. Which of the following affects the disease-producing ability of a pathogenic organism? So we're talking about which of the following affects the disease-producing ability of a pathogenic organism.
Would it be all of the above?
So let's talk about them. The disease-producing ability. Hi, Mommy. Hi, Bill. Host resistant, is that have anything to do with the disease producing ability of the pathogenic organism? What was the definition for virulence? Do you guys remember?
Wasn't it like the severity?
Mm-hmm.
Is the strength the ability that causes the disease?
Correct.
Mhm.
So knowing that, and then numbers, I don't know what that means. Let's make an educated guess.
B,
As in
virulence.
what?
B as in boy.
Okay, I'm sorry.
I
I'm like, as in what?
was reading to myself. I'm sorry.
Oh, you're fine. Okay. So let's say we don't know this. This is just talking about the pathogenic organism, okay? Does host resistance have to do with the pathogenic organism? Probably not, right? I mean, this is not affecting the disease producing ability of the organism. It's affecting whether you catch it or not, but that's not what the question's asking, right? So make sure that you really read the question. And if it can't be A, it can't be D, right? So, all right, well, let's see what the right answer is. Look, the chain of infection includes what?
C.
As in cat, right?
Yep.
Immunity that results from vaccination is, so we talked about this already. Always use the test to take the test.
Artificially acquired.
An infection that occurs through mucosal surfaces of the eyes, nose, or mouth is a
C.
Why is it C? What is indirect contact again? All right, well, let's put it and we'll see what comes up.
I
Okay.
think parental transmission. Parent D.
Nope.
No? Oh,
All right, so let's talk about again, what is parenteral transmission?
That's if a break in the skin, right?
Mhm.
So it can't be D.
Well, let's leave C for now and see what the answer comes out as, okay? A persistent infection in which symptoms come and go is called
Chronic.
what is a chronic infection?
Something over an infection that lasts a while,
What is a latent infection?
where the results of the infection don't always happen right away.
Sometimes they lay,
Dormant.
but they,
Reactivate.
which means they,
Come and go.
food handlers' gloves are a good example of
Over gloves. Wait.
B.
A and B too.
I think it's
I think it's A and B.
A and B, so D.
yeah, so D.
Yeah.
The most serious type of latex allergy that can result in death is what?
A.
Medical waste disposal required records include all of the following except
D.
saliva is of concern in dentistry because it is often contaminated with blood.
False.
I heard one true, one false.
I say true.
What are we doing in the mouth? What are we doing in the mouth?
Suction.
Huh?
Suctioning.
That's what we're doing.
drilling.
No.
We're drilling. What else are we doing? What about the hygienist? What's she doing?
Scaling. So it has
And?
to do with cavity.
Cavatroning.
Cavatroning. And what else? What about when she's checking the pockets?
Yeah, there's blood.
Probing.
Is there blood associated with any of those things?
Yes.
So the answer might be, it's not that in dentistry, people are just drooling. Okay, typically we're doing something else in the mouth and that usually the saliva is contaminated. Okay. Immunizations highly recommended for healthcare personnel include varicella zoster.
False.
Which one is recommended for healthcare personnel?
That B.
Mhm. Extracted teeth returned to the patient do not require special handling.
False.
There is no known cure for a latex allergy.
True.
True.
All right, let's see how we did, guys.
50.
I'd say 50, 80%.
Oh, look,
Okay,
we did better.
good. So let's see which ones we did not get right. Well, let's go through all of them and okay. So when contaminated instruments or surfaces transfer pathogens, it is indirect transmission. This is so important. You need to know the difference between direct and indirect. Direct is person to person. you're getting it from the other person directly. Indirect is there's an inanimate object in between you. Either you're getting it from an instrument, you're getting it from a surface, but something that the patient has been in contact with that you are now in contact with. There's a middleman and it's inanimate. Okay, it's indirect. All right. The herpes virus is transmitted through all the above. It's not telling us which herpes virus. If it says herpes simplex 1, then we would say A and C, but it didn't specify, right? So the answer is D, all of the above. The ability of a pathogen to overcome the body's defenses and cause disease is known as virulence, okay? Virulence is the strength of the disease. Transmission through the eyes or mouth is known as permucosal. I think it was Zachary, was that you that said that?
Yeah.
Okay, guys, use these words, take them apart. Literally the word mucus is in here, okay? Or something similar to that. So our mucous membranes include eyes or mouth, all right? So that was a great deduction. Even if you didn't know what permucosal is, all right? You could determine what the answer was. So use what you know to answer the questions, okay? Which of the following is not a type of infection? Genetic. We have, what's a latent infection? What is that again?
When symptoms come and go.
Come and go and lay dormant over time sometimes, right? Acute is what?
Severe and quick.
Yep. And then chronic is
A long period of time.
long period of time, all right? Examples of, my computer's ready. Portal of entry for pathogens include a human bite, yes. Break in the skin, yes. Needle stick injury, yes. These are all portals of entry. All right, so the correct answer is D. Which is spread through direct transmission? They are all spread through direct transmission. Okay, direct transmission is person to person. If someone has Hep B and you come in contact with them without any PPE on, direct transmission, you can contract it. You can contract HIV through direct and indirect. It didn't say only direct. Okay. And then tuberculosis, if someone coughs in your face and you're not wearing PPE, yes, you could certainly catch that as well through direct transmission. We talked about the box. Immunity required through vaccination is referred to as artificially acquired immunity. All right. You learned about it, remember it, use the box that we saw, and deduct the right answer. All right. Which of the following affects the disease-producing ability of a pathogenic organism? Apparently the answer was all of the above. So whoever said that was correct. This is going to affect the host resistance will affect the disease-producing ability. If your immunity is down, okay, then you can contract that disease. I read this question a different way, but the numbers of the pathogenic organism, if you're not disinfecting, then you'll have higher numbers of the pathogenic organism, and that can affect the ability of the pathogenic organism. Okay, so whoever said all the above was correct. Chain of infection includes virulence, microorganisms, susceptible host, and portal of entry. These can be said in different ways, but they are all correct. All right. Immunity that results from vaccination is artificially acquired. Okay, you have to go and get a shot in order to be vaccinated. An infection that occurs through the mucosal surface of the eyes, nose, or mouth is a droplet infection, okay? Something has to actually land in those mucoceles in order for them to be infected. Indirect would be touching an instrument and then touching your own eyes, all right? And again, parenteral is what?
Breaking the skin.
The breaks in the skin.
Right, okay? A persistent infection in which symptoms come and go is latent. Sometimes they're dormant, sometimes they're active. So they come and they go. All right. Food handlers' gloves are a good way to prevent cross-contamination. That is true. If you put them on over your dirty gloves, you can then go into the drawer or the container and get what you need. And over gloves is another way of saying food handlers' gloves. So perfect. Type 1 is the most serious type of latex allergy. We do not need the license number of the employee disposing of the waste, but we do need to know how, when, and where it's disposed of. Okay. Saliva is of concern in dentistry because it is often contaminated with blood. All right. And then immunizations, highly recommend for healthcare. Really? Okay. Interesting. So let's look this up for a second. Varicella. Maybe that's another way of saying, but I don't think so. I might call fake on this one. I swear no one checks these. I find mistakes all the time. Let's see. Oh, if you look at page 277, airborne transmission is known as droplet infection and refers to droplets of moisture that spread when someone coughs or sneezes. Just in case you're wondering. I am looking for this, and I am having a hard time finding this. Varicella zoster. Oh, let's see if I can figure out what the varicella zoster is. Let's see. Maybe there's another name for it and I don't know it. Ah, that is the chicken pox.
Oh,
Okay.
that's funny. That's how you say it in Spanish.
Is it really?
Varicela. Yeah.
That's, you know what? I find a lot of people that know Spanish are really good at finding root words of things. Like even for dentistry, like I tell my one radiology class this semester is all Spanish speaking.
Yeah.
And I said I was trying to explain the different sides of the teeth and I was like labial, right?
Labial.
Lip, like labia, and then lingua is tongue, right? So I'm like, sometimes if you know that, you can determine other things. All right, so I mean, I guess it's recommended. I mean, I feel like everybody gets it now, so.
Oh God, and I answer those too. Oh geez, I screwed up the test.
What?
And I answer those two myself.
Oh yeah, but I mean, yes, it's true, but I mean, either we've all had chicken pox or we had the vaccine already, right?
Yeah, yeah.
So I would question that one.
Yeah.
So here's the thing. This is what the book said.
Okay.
Once you give those teeth to the patient,
That's it. Oh, interesting. I feel like these kind of questions tend to get you on the test. For me, it's a little confusing. I don't know if it's the English and the Spanish. You know, when you read,
Just, they're set up to confuse you.
oh God, like I would think that's, you know, I don't know.
Right. And you would think that that was the case, but if you give them to the patient, then that's,
That's it. You're
You're
done.
done.
Okay.
all right. I don't give mine to the patient.
Oh, me neither.
Right. But if you do, then,
Yeah.
all right. No cure for latex allergy. Okay. So we got an 80. We're getting better. You know, again, a lot of times if you break down the, you know, the parts, it makes it easier to determine the answer. Okay. So definitely use the test to take the test and use the words you know in order to, all right. What do we have next? Principles and techniques of disinfection. Fun. Okay. During patient treatment, surfaces and equipment and treatment rooms are likely to become contaminated with saliva or by aerosol containing blood, saliva, or both. Okay, fact.
Sorry.
Lab studies have shown that microorganisms may survive on environmental surfaces for varying periods, and assume that if a surface has had contact with saliva, blood, or other potentially infectious material, it contains live microorganisms. All right, so this is part of our standard precautions, right? The Center for Disease Control, CDC, and Prevention, Guidelines for Infection Control in Dental Healthcare, 2003, divide environmental surfaces into clinical contact and housekeeping surfaces. What's the difference? What would you suppose a housekeeping surface is? Think about your
Floors,
house.
Things.
What do you have to clean all the time?
Kitchen counter.
Counter, yes, but in our dental office, the counters we may be touching, right? But things that don't need to be cleaned after every patient. So floors, walls, sinks, things that aren't used all the time. You may use the counter to place stuff on, right? Depending on how your office is set up. I don't have a dental counter in my office, but in places that I worked where I did have one, I used it to, you know, put things out that I was going to use. So I was using it like for the procedure. Okay. So housekeeping surfaces, because they have a much lower risk of disease transmission, cleaning and decontamination are not as rigorous as they are for clinical areas and patient treatment items. So we're talking about not that floors shouldn't be cleaned, not that sinks shouldn't be cleaned, but you don't need to clean them after every patient. Okay. I can't imagine you having to wet the floor after every single patient. You would need 2 hours for every patient. All right, so those are housekeeping surfaces. Cleaning and disinfecting considerations, the amount of direct patient contact. If you're seeing a patient for nothing but a consultation, do you need to worry about the countertops? Chances are probably not, right? Do you need to worry about dental supplies? Chances are probably not, all right? But if a patient is being seated and you're doing a procedure on them, you're doing a crown, you're doing a filling, you're doing an extraction, now these are all areas that need to be cleaned and disinfected, okay? So the type and frequency of hand contact, potential amount of contamination by aerosol and spray, and other sources of microorganisms like dust, soil, and water. Now, clinical contact surfaces can be directly contaminated either by spray or spatter generated during dental procedures or by contact with our gloved hands, right? Current infection control guidelines for the Office Safety and Asepsis Procedure Research Foundation, otherwise known as OSAP, not to be confused with OSHA. Okay, so this is Office Safety and Asepsis Procedure Research Foundation. Recommend that clinical surfaces be classified and maintained under 3 categories: touch, transfer, splash, spatter, and droplet. Okay, so just looking at these, what do you think would be an example of a touch category? No. What do you think would be an example of a touch category? Maybe like a countertop, right? Okay. Something that you touch. How about a transfer? Maybe like a patient chair where they're sitting. Splash, spatter, and droplet. That might be the light fixture or, you know, something that the areas of, like if the tray is connected to your chair, that might be an area where you might get splashed, spattered, and droplets, okay? Touch surfaces are directly touched and contaminated during treatment procedures, okay? This includes handles of dental lights, control of dental units, chair switches, chairside computers, pens, telephones, containers, and drawer handles. So things that you touch directly. So whatever you touch during that dental procedure, if you touch the counter, if you touch the drawer handle, if you touch the dental light, these are all going to be directly touched and contaminated during treatment procedures. All right, so that's going to be the touch surfaces. Transfer surfaces are not directly touched, but often are touched with contaminated instruments. These include instrument trays and handpiece holders. Splash, spatter, and droplet surfaces do not actually come into contact with the members of the dental team or contaminated instruments or supplies. Countertops are a major example. So they're gonna, so if you don't directly touch these countertops, they're still gonna be contaminated with splash and splatter if they're close to the area that you're working at. Okay, so we have direct touch, we have transfer where we transfer instruments like our tray, and then we have splash, spatter, and droplet, which we may not directly touch, but they're still getting soiled. All right. So here we have clinical surfaces. So let's look at them. So A would be an example of.
It's a
Touch, transfer, or droplet.
Touch.
Touch. We're going to directly touch these light handles. We're going to directly touch the buttons to fix the chair, right? How about transfer? That's going to be our what?
Handpiece holder.
Our B areas, okay? So the patient may transfer or something may get transferred onto the chair, transferred onto the tray, transferred onto the handpiece holders, transferred onto the assistant chair. And then C is going to be what?
Countertop.
Which is,
Oh, splash, spatter, and drop.
I'm like, I know it's a countertop. Good. So while the doctor's working, it's possible that all these areas right here might be contaminated with splash and splatter. All right. There are two methods of dealing with surface contamination. Either surface barriers, which cover areas, right? We discussed them. And then pre-cleaning and disinfecting surfaces between patients. So what is the deal with surface barriers? We should barrier what? Anything that can be barriered, we should barrier, okay? There's a wide variety of surface barriers available today. They should be resistant to fluids to keep microorganisms in saliva, blood, or other liquids from soaking through the surface underneath. Some plastic bags are designed in the shape of items such as dental chair, air water syringe, hoses, pens, and light handles. Plastic barrier tape is frequently used to protect smooth surfaces like touch pads on equipment, electrical switches, x-ray equipment. Aluminum foil can also be used because it is easily formed around any shape. I've never seen anyone use aluminum foil, but apparently you can. So this is what water looks like when it's on a fluid resistant material. Okay. These are some tube socks that go over your air water syringe and your suctions. You may or may not have them. If you have a barrier, then you don't need to do what?
You don't need to clean them, disinfect them after?
Correct. Now, on these, you don't need to clean this part. You'd still need to clean,
Yeah,
okay?
yeah.
Just to reiterate. Okay. Single-use disposable items are used on only one patient and then discarded. Can you think of something that is a single-use item that we use every day?
Coffee cups, brushes, no?
Saliva ejector, high volume evacuation, right? Maybe your air water syringes, if they're not metal, they may be one use, okay? Used on only one patient, then discarded. They can help reduce the chance for patient-to-patient contamination. Single-use items are often made of plastic or less expensive metals, and they are not intended to withstand cleaning, disinfection, or sterilization. Never process single-use items for use on another patient. That is not what they're meant for. All right? In most areas, contaminated disposable items that are not sharps, sorry, and are not soaked or caked with blood may be discarded with the regular office trash. There is no need to discard these items in a medical waste or biohazard container. State and local regulations may vary, so always consult the regulatory agency for your area. Although no cases of cross-contaminate or cross-infection have been linked to dental treatment room surfaces, cleaning and disinfection of these surfaces are important components of an effective infection control program. Okay, so when it says, in addition, the OSHA bloodborne pathogen standard requires that contaminated work surfaces be disinfected between patient visits. What does that word mean? How do we disinfect something?
Wiping it down.
Wiping it down how many times?
Twice.
Twice. The first time, so if you're using wipes, the first time we wipe it down, it's called the pre-cleaning. We remove debris. That's called pre-cleaning. So either we wipe, dry, wipe, let it sit, or spray, dry, spray, let it sit. Okay. If you're doing it once, are you disinfecting?
No,
No. What are you doing?
you're just taking the
You're cleaning.
yeah, you're just cleaning. Yeah.
Okay. Are they the same thing? No. Cleaning and disinfecting are not the same thing. Okay. If you're doing it once, again, I understand everybody works in a dental office, and things don't always happen the way that they should, but I'm telling you, it needs to be done twice. First wipe is pre-cleaning, second wipe is disinfection. Okay. Pre-cleaning means to clean before disinfecting. All contaminated surfaces must be pre-cleaned before they can be disinfected. Even if there is no visible blood on a surface, it must be pre-cleaned because even a thin layer of saliva on the surface can decrease the effectiveness of the disinfectant. Pre-cleaning reduces the number of microbes and removes blood and saliva, also called bioburden. All right, does everybody understand that? These techniques are most effective when used on contaminated surfaces that are smooth and easily accessible for cleaning. Always wear utility gloves, mask, protective eyewear, and protective clothing when pre-cleaning and disinfecting. Surfaces that are irregular or textured are difficult or impossible to clean, thereby making them difficult to disinfect as well. Regular soap and water may be used to pre-clean, but is more efficient to select a disinfectant that can be used to clean as well as disinfect. Disinfection is intended to kill disease-producing microorganisms that remain on the surface after pre-cleaning. Spores are not killed during disinfecting procedures. Remember, I said you can lower the number of spores, but what is the only thing that kills the spores?
Sterilization.
Sterilizing, right? Do not confuse disinfection with sterilization. Sterilization is a process in which all forms of life are destroyed. Okay. Chemicals that are applied to inanimate surfaces are called disinfectants, such as countertops, dental equipment. Antiseptics are antimicrobial agents that are applied to living tissue. Disinfectants and antiseptics should never be used interchangeably because tissue toxicity and damage to equipment can result. All right, you should never be disinfecting your hands with a disinfectant. All right. Disinfectants are chemicals that destroy or inactivate most species of pathogenic microorganisms. In dentistry, only those products that are EPA registered hospital disinfectants with tuberculocidal, remember we talked about that, which kills the tuberculosis bacteria, claims should be used to disinfect dental treatment areas. Mycobacterium tuberculosis is highly resistant to disinfectants. And if a disinfectant will inactivate M. tuberculosis, it will most certainly inactivate the less resistant, microbial families on the treated surface. Okay. So what this is saying is, remember I said, look at your side of your bottle. And if it says tuberculocidal, chances are that's a high level disinfectant. Okay. Because if it kills this tuberculosis, it's probably killing everything else too. All right. It is not killing spores. All right. But it is a high level disinfectant that can reduce the number of spores. Any ideal surface disinfectant would rapidly kill a broad spectrum of bacteria, have residual activity and minimal toxicity, not damage the surfaces to be treated, be odorless and inexpensive, work on surfaces with remaining bioburden. Liam, you're being very loud. Okay. And be simple to use. No single disinfectant product on the market meets all of these criteria. When selecting a surface disinfectant, you must carefully consider the advantages and disadvantages of various products. All right, so it would be great if we had an ideal surface disinfectant that did all of this, okay? But there isn't one that meets every single one of these criteria. Follow manufacturer's recommendations for mixing and diluting, application, shelf life, activated use life, and all safety warnings. All right, so if we're talking about the categories of disinfecting and sterilizing, we have a sterilant, or something that sterilizes, that destroys all microorganisms, including a high number of bacterial spores, okay? An example of a sterilant might be glutaldehyde, all right? Does everybody here still use that? Cold Steril, it's called?
Yep.
I hate that stuff.
No, it's terrible.
It's so toxic. So obviously it doesn't meet all the criteria anyway, but so that is a way to sterilize. However, you have to follow manufacturer's instructions. If you put something in Cold Steril for 10 minutes, it's not sterile. It has to be in there for something like 24 to 48 hours, depending. All right, so you have to follow manufacturer's instructions. Also, it's toxic. So when you take it out of there, you really need to rinse it off. All right, otherwise you're putting your patients and yourself at risk. Should never go over there without a mask. Pregnant women shouldn't be near it. Should be touching anything in there without gloves on. All right. High level disinfectant destroys all microorganisms, but not necessarily high numbers of bacterial spores. So again, that can be glutaldehyde, hydrogen peroxide. For heat sensitive reusable items, immersion only. Intermediate level disinfectant destroys vegetative bacteria, most fungi, most viruses, inactivates the tuberculosis. All right, so it's tuberculocidal. So this intermediate level disinfectant is fine to use when disinfecting your rooms, okay? This low level disinfectant that does not inactivate tuberculosis should not be used. They could be used on housekeeping surfaces only, meaning like the floors, the walls, okay? But they're not going to help you disinfect unless they have that tuberculocidal, all right? So really read your bottles. Iodophores, EPA registered intermediate level hospital disinfectants with tuberculocidal action. Because iodophores contain iodine, you see that word in there kind of, they may corrode or discolor certain metals and may temporarily cause reddish or yellow stains on clothing and other surfaces. So that's not always a good choice. Synthetic phenol compounds, EPA registered intermediate level hospital disinfectants with broad spectrum disinfecting action. They can be used on metal, glass, rubber, or plastic. They may be used as a holding solution for instruments. However, phenols leave a residual film on treated surfaces. Okay, also, this compound must be prepared and disposed of daily. Okay, so any leftover. So what does that make it? Not very cost effective, right? Okay. Something like this. Sodium hypochlorite or household bleach is a fast-acting, economical, and broad-spectrum intermediate-level disinfectant. Bleach solution is unstable. It must be prepared daily. It has a strong odor. It's corrosive. It's destructive. It's irritating, and it may cause plastic chair covers to crack. Is this a good choice?
No.
Probably not, okay? Alcohol is not effective in the presence of blood and saliva. It evaporates quickly. It damages materials. It is not recommended as a surface disinfectant by several agencies, okay? I remember my teacher 20 years ago said to me, if you're gonna clean something with alcohol, you may as well just spit on it. I just always remember her saying that. All right, immersion disinfectant. Some chemicals on the market can be used for sterilization or high-level disinfectant. When used as sterilants, they destroy all microbial life, including bacterial endospores. So if you're using this glutaldehyde in the room instead of as an immersion, it can help to kill some of those spores. Depending on the type, time for sterilization can range from 6 to 30 hours. That's a long time. All right. At weaker dilutions or with shorter contact time, these chemicals provide high-level disinfection, inactivating all microorganisms except endospores. Most of these chemicals are toxic. They can irritate the eyes, skin, and lungs, and PPE must be worn with them. Okay, so using glutaldehyde in the room, even in a diluted sense, it is so toxic, it would not be my choice. I would not use it. All right, in a covered instrument tray, it's fine. I still don't like it, but it does the job it's supposed to do. So. Glutaldehyde immersion disinfectant, classified as a high-level disinfectant or sterilant. It can also be used as a liquid sterilant when immersion time is increased. It's useful for plastic and other items that cannot withstand heat sterilization. It's very toxic and should be handled carefully to avoid fumes. Glutaldehyde treated instruments should never be used on patients without first being thoroughly rinsed with water. Prolonged contact of certain types of instruments with glutaldehyde can lead to discoloration and corrosion of the surfaces and cutting edges, okay? If you have an autoclave in your office, which I sincerely hope you do, all metal goes in the autoclave, okay? I mean, we literally use this glutaldehyde for like trays that we didn't use, or like some of the ortho stuff can't be autoclaved safely. So we might put like cheek retractors in there, but never anything metal should go in there. Chlorine dioxide is an effective, rapid-acting environmental surface disinfectant for 3 minutes or chemical sterilant for 6 hours. Chlorine dioxide does not readily penetrate organic debris and must be used with a separate cleaner. Chlorine dioxide must be prepared fresh daily. It must be used with good ventilation and is corrosive to aluminum containers. Again, what is chlorine dioxide? We don't have a picture of it. Okay. So if you use it for 3 minutes on a surface, it can be used as a disinfectant. If you immerse something in it for 6 hours, it can be used as a sterilant. OPA or ortho-formaldehyde immersion disinfectant is classified as another high-level disinfectant. OPA is effective with achieving high-level disinfection within 12 minutes at room temperature. More expensive than glutaldehyde, but maybe a good alternative for individuals with a sensitivity to glutaldehydes. It has very little odor and does not require activation or mixing. So this sounds like a better choice, but it's not cost effective. All right. Also, it achieves high-level disinfection within 12 minutes. So 12 minutes, when we look at it, doesn't sound like a real long time, right? But think about having to let something sit on your chair or in your operatory for 12 minutes before you bring someone in. All right. But I guess depending on how busy your office is, like I don't have an extra 12 minutes between patients. All right. 12 minutes is a long time for something to have to sit on a chair. The disadvantages are it's costly and can be used only half as long as most glutaldehydes. It may stain skin and fabrics. It turns plastics a blue-green color, and it would require more than 30 hours to secure sterilization. All right. So again, it looks like every single one of these has pros and cons, right? Your evacuator system, high volume evacuation reduces the risk of saliva escaping from the patient's mouth. That's our HVE, right? High volume evacuation. Regular cleanings help tubes and pipes flow easier, and we clean it by flushing with detergent or water, and we periodically clean the traps. Every day before you leave, you should be running your lines with some sort of slug buster or cleaning solution. If you have a surgery, you should be doing it more than once a day, and at least once or twice a week, you should be cleaning your traps. Okay. There is no scientific evidence showing that housekeeping surfaces such as floors, walls, and sinks pose a risk for disease transmission in dental healthcare settings. Majority of housekeeping surfaces need to be cleaned only with a detergent and water or an EPA registered hospital disinfectant or detergent. It does not need to be high level. It does not need to be intermediate level. Okay. However, use solutions of detergents or disinfectants, especially if prepared in dirty containers, may be reservoirs for microorganisms. Make fresh cleaning solution each day, discard any remaining solution, and let the container dry to minimize bacterial contamination. If you're mixing your own, it should be mixed every day. Okay. Carpeting is more difficult to clean than is non-porous hard surface flooring and cannot be reliably disinfected, which is why should never be carpet in the dental room. Okay. Studies have documented the presence of bacteria and fungi in carpeting. Cloth furnishings pose similar contamination where direct patient care is performed. And the CDC guideline says avoid using carpeting and cloth upholstered furnishing in the operatories, laboratories, and instrument processing areas. This does not include the waiting room, although at this point you should still have chairs that can be wiped down or sprayed. Okay. Spills of blood and body substance. The majority of blood contamination in dentistry results from spatter and the use of rotary or ultrasonic instruments. No scientific evidence shows that HIV, HBV, or HCV has been transmitted from a housekeeping surface. OSHA requires that blood spills and other body fluids be removed and the surfaces disinfected. So if you spill something on the floor, then it's required that you disinfect it. I'm sorry? Did someone have a question for me? No. Okay.
Oh.
Yes? Okay. CDC guidelines says clean spills of blood or other potentially infectious materials and decontaminate the surface with a hospital disinfectant with low level to intermediate activity depending on the size of the spill and the surface porosity. Okay, so if you spill something somewhere, it needs to be cleaned up and disinfected. But on a regular basis, the floors don't need to be disinfected. They just need to be cleaned, okay? I would love if this was the case. So greener infection control is protecting the environment has become an important part of our personal lives. That responsibility extends to the provision of dental care. Many of the infection control products and procedures we use to protect our patients and ourselves have a negative impact on the environment. Okay, when you're talking about these high-level disinfectants, they're not good for us. They're not good for the environment, but you know, we want to make sure that it's clean. Like I wouldn't trust cleaning with coconut oil or whatever the newest phase is. You know, I would want to clean with something that I know I could disinfect the area with. By altering a process or material, it's possible to minimize a potentially negative impact. For example, using disinfectant wipes instead of spraying could reduce the amount of chemicals in the air. Going greener requires thoughtful planning, research, and experimentation. Digital patient records could have a significant impact on the amount of paper. I don't know about North Jersey, but I think all the offices down here, I don't know whether they are or not, but they are supposed to all be paperless. All right. Radiology, again, is huge right now. Digital radiology is becoming state of the art. That is important because the less oh my God, I'm having another brain fart today. The less the patient has,
Radiation.
thank you. I'm like, oh my God, I can't even think right now. The less radiation to the patient, the better for the environment, the better for the patient, the better for us. Okay, thank you. Losing my mind. Personal protective attire, protective barriers present a challenge in the attempt to go greener. Some are recyclable, most are not. For my office, our PPE, we don't use disposable gowns. We use gowns and have a cleaning surface, clean it. So that's how we're being a little greener. Surface barriers and pre-cleaning and disinfection involve the use of chemicals and PPE. Okay, so we try, but the thing is, going green is important. Safety to ourselves and our patients trumps that. All right. Any questions? No? All right, let's do our little quiz on chapter 20. And see how we do. All right, intermediate level disinfectants must be capable of killing what?
See,
The disinfectant capable of leaving a reddish stain is, look at the words and it should help you remind you of what it is.
C, no?
C. So what word do you notice in this word?
Ion, what is it? What is it?
Like iodine, right?
Yeah.
And so what is iodine? They put it on your skin before they like give you a needle, but it's like this reddish brownish stuff.
Yeah.
So it would make sense that that material would leave a reddish stain too. Okay. Blank is commonly known as household bleach. Anyone that works in endodontics should know this off the top of their heads, but
Sodium hypochlorite.
sodium hypochlorite. Go get the door, please. Thank you, sweetheart. Agents that prevent the growth or action of microorganisms on living tissue are where do you use disinfectants?
B.
Let's talk about it first. What can be sterilized?
Metals,
Metals. What can be disinfected?
surfaces. So it would be
What do you use
antiseptics.
antiseptics on?
Human skin,
So what's the question?
living tissue.
So what's the answer?
A.
A.
Glutaraldehyde A are able to penetrate blood and bioburden. B can be used for surface disinfection. C are classified as sterilants or disinfectants. D, both A and C.
I think it's B. Right?
B?
Or because the longer
D.
you leave it in the glutaraldehyde, then it becomes sterile. So then it's D.
D?
Yeah.
Tuesday, yeah.
Synthetic phenol is a 1 to 100 dilution. Oh, in a 1 to 100 dilution is
It's C. Oh, geez. Let me see.
C.
I said C. I don't know.
Okay. Anybody else? If not, let's put C and see what it is. C. Iodophores are well, let's talk about this. What do we know about them? Are they intermediate level disinfectants?
Yes.
Are they recommended? I didn't mean to hit that. Sorry. Are they recommended for disinfecting surfaces? You're leaving? Okay.
Yeah.
So I'm not 100% sure if they're inactivated by hard water, but it would stand to reason that if 2 of these are correct, it might be all of the above. So if you think both of these are correct, why would it not be recommended? Use your test to take your test.
Because of the stain.
So I'm going to say either B or D, but you guys make the call.
Let's go for D.
As in,
As in dog.
thank you. I'm sorry. All the letters sound the same to me. Which level of disinfection kills some bacterial endospores and inactivates Mycobacterium tuberculosis?
B.
Which statement is not true regarding holding solutions? First of all, what is a holding solution? When we're cleaning instruments, if you don't have time to clean the instruments right away, you should put them in a
Solution.
holding solution, okay?
Solution.
So a holding solution is something that you put the instruments in before you ultrasonic them. Why do you suppose you do that?
So it takes some off the takes a little bit off of the debris, right?
And it prevents them from
Stain.
like blood and stuff drying on them. Because once
Right.
blood is dried on them, how do you have to get it off?
Yeah.
You have to use like a brush or something, correct?
Which is not recommended because
recommended.
what happens when you use a brush on an instrument?
Everything starts to splatter around.
Right, okay. So now knowing what we know about a holding solution, let's read these statements again. They prevent the drying of blood and debris on instruments. Is that true? or
Makes sense.
false?
Yeah.
Dishwasher detergent makes a good holding solution.
No.
It's just a holding solution. And a disinfectant alone can be used as a holding solution. And they should be changed at least twice daily. So which statement is not true?
They should be changed.
I think D.
Say that
D.
as in
They should be.
B.
Should be the
I'm
last.
sorry.
Oh, no, I'm confused. They should be.
So we know they prevent the drying of blood and debris,
Yes.
right?
Yes.
So we know that's right. So we can
True,
cross
yeah.
that one out. So now we have 3 left. Should they be changed at least twice daily?
I think it's 1. No?
What do you think it is?
1.
1, there's not even any numbers. A?
No.
I think she's saying like they would be changed just
One
once a day.
time.
Oh, 1,
Once a
I'm
day.
sorry. I'm like, 1, where do you see 1?
Good thing we're not wearing a mask.
I'm losing my mind today, you guys. All right. Okay, so which one do you think? It doesn't matter. We'll get the answer. So you think they should be changed at least once,
I
not
think so.
twice?
Yeah.
All right, so let's try that one. Acceptable methods for surface disinfection include the use of barriers, true or false,
True.
pre-cleaning and disinfecting after each use,
True.
the spray wipe technique,
So it would be D because that doesn't include the second wipe down.
that is correct. Well, it doesn't include the second spray, right?
Mm-hmm.
Appropriate PPE to be worn when cleaning and disinfecting environmental surfaces include all the following except
Shoe covers.
shoe covers,
Yeah.
disinfectants for use in dentistry must be registered with the
EPA.
a good way to remember that is we're talking about being environmentally friendly, right? So the EPA is the Environmental Protection Agency. If you have any questions regarding disinfectants, that's who you need to call. Okay, the EPA. Cleaning of spills or blood or other potentially infectious materials should be done with a
Okay.
first of all, do we ever use low-level disinfectant to clean blood?
Never.
No,
I would say A.
I think it's A just because it says sterilant and C doesn't say sterilant.
Greener infection control practices include all the following except
I think it's C.
C, as in cat.
Mhm. Yep.
The ADA, the CDC, and OSAP recommend the use of alcohol as an environmental surface disinfectant.
False.
False.
B.
All right, let's submit this. I think a couple of these were not correct, but let's see what we get. All right, so we got a 67. So let's see what we got wrong and why we got them wrong, okay? Intermediate level disinfectants must be capable of killing tuberculosis. That is 100% true. The disinfectant capable of leaving a reddish stain is the iodophore. Okay, it has iodine in it. It's going to leave that reddish stain. Blank is commonly known as household bleach. That is sodium hypochlorite. Anybody that does root canals knows that's what we clean out the canal with. So that should look familiar to you. Agents that prevent the growth or action of microorganisms on living tissues are antiseptic. All right. That's correct. Glutaldehydes are not able to penetrate blood and bioburden. They are classified as sterilants and disinfectants only. Okay. So before you put anything in the autoclave, it needs to be what?
Wipe down.
More than wiped down. What does it need to be? Ultrasonic, right?
Mm-hmm.
So if you are using your glutaldehyde as a sterilizer, okay, can you just throw bloody instruments in there? Close the door, please. No, the answer is no. Okay. So the reason we use the ultrasonic is to shake off, right, the blood and bioburden, or we use a pre-cleaning solution, or we scrub our instruments, but you can't just throw bloody instruments or trays into glutathione. It doesn't penetrate blood and bioburden, but it will sterilize if left in there for 30 hours. All right. But you would never just take a bloody instrument and put it in the autoclave without cleaning it first, right? Right. We still have to like pre-clean it by putting it in the ultrasonic or, okay. So same thing. So yes, it'll sterilize it, but it's going to sterilize it with the dried blood on it unless we clean it off first. Okay. Same thing with the glutathione. Synthetic phenol in a 1 to 1,000 dilution is an intermediate level disinfectant, can be used on countertops and walls, and is not stable, must be, so all of the above are true. Okay. Iodophors are all of the above. They are inactivated by hard water. They are intermediate level disinfectants, and they are recommended for disinfecting surfaces. Okay, the one downfall is they may stain your surfaces, but they are recommended to do it. Which level of disinfection kills some bacterial endospores and inactivates Mycobacterium tuberculosis? That's going to be the high level disinfection. Okay. Intermediate level disinfection sometimes kills the endospores, sometimes doesn't. Typically, they are not the tuberculocidal ones. All right, the intermediate level disinfection, let's look it up just to be on the up and up.
Inactivo. Mycobacterium tuberculosis. It's intermediate level.
Intermediate level?
Yes,
Are you talking to me? I'm sorry. What page are you on?
it's 315.
Some of them have tuberculocidal, right?
Yeah.
In dentistry, only those products that are registered with the EPA as hospital disinfectants with tuberculocidal claims should be used to disinfect dental treatment areas, right?
I can't hurry up.
Am I missing the part you're talking about?
315 in the top.
Oh, I'm sorry. Thank you.
Okay.
So it inactivates tuberculosis, but it does not kill spores. Okay. So the only thing that kills the spores is the high level. Right?
Yeah.
So because it has both of those things, if it just said inactivates the tuberculosis, intermediate level would be correct. But because it says it kills some of the bacterial endospores, it has to be the high level.
Yeah.
Okay. And again, some of these questions are made to trick you. So you have to like spread the question out and really read all of it. All right. Because you're right about half of it. You're right. That intermediate level is tuberculocidal, but it does not help to kill the endospores. Only the high level does. All right. For the holding solution, it should be changed twice daily. Dishwasher detergent is an excellent holding solution. The only thing that cannot be a holding solution is a disinfectant alone. Okay, you can't just put your instruments inside a disinfectant and have that be the holding solution because that's not going to clean it off. Okay, it's not going to help prevent it from being dry. Okay, dishwasher detergent will. It prevents it from drying in debris. and it should be changed at least twice daily, but cannot use disinfectant for that. Okay. Acceptable method of surface disinfection is barriers and pre-cleaning disinfecting. And I believe, Zachary, you were right when you said this should say spray, wipe, spray technique, right?
Mm-hmm.
Appropriate PPE, shoe covers are not necessary. Disinfectants used in dentistry must be registered with the EPA. Cleaning spills of blood or potentially infectious material should be done with an intermediate level disinfectant. Okay, if we're talking about a sterilant, okay, where is blood spilling? Typically, where would we spill blood? Onto the what? The floor, right? So we can't sterilize the floor. And a high level disinfectant isn't what is typically used. What is typically used is the intermediate level disinfectants, all right, to clean up a blood spill. Greener infection control practices include all of the following except using a lower wattage light bulb in the overhead light on the dental unit. Why would we not want to do that?
That would interfere with our vision.
Yeah, I mean, how low can the light be? You know, we still do need to see the patient. And then the ADA, CDC, and OSAP never recommend the use of alcohol as a disinfectant. Okay. So does everybody understand the ones that we got wrong and why they were wrong?
Mm-hmm.
Okay. Let me see this for a sec. So I just want you guys to watch this real quick film. It's literally a minute long. I don't know if you can hear this or not, but it's in subtitles too.
When performing treatment room cleaning and disinfection, the dental assistant is wearing PPE and utility gloves, goggles, and a mask. Check to see that the solution has been prepared according to the manufacturer's instructions. The dental assistant removes contaminated barriers and disposes of them in the general waste. The first step in the cleaning, disinfecting two-step process is to clean, starting with the patient chair at the head and shoulder area, which are high areas for contamination. Any surfaces that are not protected by barriers or have become contaminated during removal of the barriers must be cleaned and disinfected. Be careful not to spray into electrical switches or components. All potentially contaminated surfaces must be cleaned and disinfected. This includes the operator and assistant stools, as well as the adjustment handles. Next, spray and clean the surface of the dental unit. When cleaning a large area, it may be necessary to use several paper towels or gauze pads to avoid simply spreading the bioburden instead of removing it. Smooth surfaces are easily cleaned and disinfected with paper towels or a gauze pad. To reduce overspray when cleaning hoses, place a paper towel behind them when spraying and wipe using the paper towel. To disinfect all surfaces after cleaning, repeat the preceding steps in sequence, allowing all surfaces to remain moist for the manufacturer's recommended time.
All right, so that is how you're supposed to turn over a room. Are there any questions on that? Okay. Good. 21, 22, 23, 24. I don't know if we are going to have time to do another chapter today. So what I would like to do is, first off, does anyone have any questions? No? Okay. So, well, let's see how long this next chapter is. I don't like to rush, and we still have a whole next week as well. So let me see how long this one is. I think it's. Yeah, this one is too long for, I don't want to rush through this. So, so what we went over today was chapters 18, 19, and 20 in our MDA book. All right, what I'm gonna do is put all of these PowerPoints up on the Google Classroom. I actually like to invite you guys now, if you don't mind giving me a half a second, and make sure everybody gets the invitation, because if you don't, it's going to be an issue throughout the week, and I don't want you to be stuck not being able to get in touch with me. So can everyone give me like 1 second and I'll get it all set up? Okay. All right, and I'm going to call this what's today's date? What's today's date? Anyone?
8.
Thank you. So I'll just call this infection control 11/8 through 11/15. Is that okay?
Yes.
All right. And I'll subtitle it Dental Studies Institute, subject infection control. Okay. Now, hopefully I have everybody's email. So the email address that you sent over to us originally is what I'm going to use. Okay. So I'm going to put everybody's email address in now, and just if you guys could look for it and see if you get it, and then try to get into this classroom just to make sure that you're in here.
Turn off the light.
DGERHART. If you see me spell something wrong, let me know, because this is what I have. So
It's Francia R.
oh, thank you.
You're welcome. Peguero. Peguero.
Peguero. Pegu.
You have, yeah, you have one more R.
Oh, I
Yes.
put the R in the wrong place. Sorry
Mhm.
about that. I'm like, I thought I typed an R, but I don't know. Thank you.
You're welcome. Okay.
Okay, that should be everybody. All right, so everybody should have gotten an invitation. So it's going to take me probably a day to get the Zoom meeting up on there, because I have to download it onto YouTube, and it's like a 5-hour